Hey everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Well, today we continue with our free 3-day summit on how healers heal. We're going to be talking to 24 amazing female physicians who have their stories in this book. There's actually 33 stories in the book. I'll be linking in the chat in the show notes where you can get this book, and each day we'll be meeting 8 or 9 of them. And today, allow me to introduce Dr. Renee Thomason.
Hi, thank you, Chef AJ. I'm very excited to be able to participate in the summit. I want to start off by kind of first introducing my colleague, Dr. Gorey. Dr. Gorey is a board certified OB-GYN. She's also board certified in lifestyle medicine. She has a strong emphasis on women's health and their well-being. Dr. Gorey understands the unique needs and challenges of women at every stage of life. She is a trusted advocate. She completed her medical school education at the Arizona College of Osteopathic Medicine. She also pursued her residency at OB-GYN at Ascension Healthcare Systems in Detroit, Michigan. She's now residing in sunny Florida, sunny Central Florida. She cherishes an active lifestyle with her 3 children, her supportive husband, and her beloved Bernedoodle. What's the Bernedoodle's name?
Henley.
Oh, I love it. Dr. Gorey is also passionate about delivering meaningful health solutions. She combines her expertise in evidence-based gynecology with the transformative principles of lifestyle medicine. Her holistic approach addresses a broad range of women's health concerns, including conditions such as PCOS, infertility, metabolic syndrome, and menopause. Awesome. Take it over, Dr. Gorey.
Thank you so much. Thank you, Chef AJ. Thank you, Dr. Thomason. It is such a pleasure to be here. So the introduction kind of gives a little bit of my background and who I am and where I am, but really who I am is rooted deeply in lifestyle medicine, except I did not know that there was a name for this back then when I was going through my journey. So currently, just to kind of tell you where I am right now. Currently, I am practicing as a gynecologist with Alara Health, which is this amazing collaborative platform where I get to merge two things that I absolutely love to do and very passionate about. I get to deliver evidence-based gynecology in terms of chronic hormonal women's health conditions, specifically like conditions like polycystic ovarian syndrome, metabolic syndrome, thyroid conditions, perimenopause, and menopause. And I get to use the concepts of lifestyle medicine in this unique space where it has just not really been addressed as over time and with years of practice in the traditional clinical setting myself. I just was never able to spend the time with my patients the way that I wanted to and help patients make meaningful changes and offer sustainable solutions so that they can live their best life, take control of these hormonal conditions that were plaguing them, and be able to really reduce their risks for long-term health diseases and complications. So when I was approached to have this opportunity to work for Alara, we get to marry, again, evidence-based medicine, gynecology. We get to marry lifestyle medicine. We have the support of a registered dietitian team that gives us meaningful solutions to our patients. And really, we get to meet our patients where they are in their life experiences and come up with strategies to empower our patients so that they can be better. All of this it's my passion project. And the reason why I am super excited about it, I mean, literally, I can't stop talking about it. People are my closest family circle in my unit are like, enough, we don't want to hear you talk about this anymore. But I'm so passionate about it because I personally have struggled with a lot of these conditions. And when I was going through my journey, it was so piecemeal, and I was trying to get solutions and trying to get answers. And even as an educated provider in this space, I could not get the answers that I was looking for. I knew that so many of the conditions that I was struggling with, there was a tremendous impact of my lifestyle on what was happening to me, but I had no idea how. I didn't know how to approach this. Every time I would talk to my own providers, it was, I was given a medication, I was given a prescription, I was given something to temporarily stop what was happening, but not necessarily get to the root cause of how I can actually help myself be better. So I'd like to read a little bit from my book, from my chapter in the book. This is chapter 21. And this just kind of highlights a little bit of my journey. And I hope you enjoy. A journey of hope from burnout to blessings, how lifestyle medicine saved me. I don't recall if there was a defining moment that made me change. All I know is that I could not continue down the same path. There were so many times that my health took a backseat to the continued imbalance of work and life. The irony of the situation was that I was supposed to be the one promoting a healthier lifestyle for others. I was supposed to give advice on diet and nutrition for women during adolescence, reproductive years, and menopause. The truth was, there were many times that I felt like a fraud. My personal journey and unhealthy relationship with food and exercise began in my teenage years. Somewhere along the way, on my quest to perfection and acceptance, I learned that food and later exercise was the perfect buffer for discomfort. The discomfort was subtle sometimes. It came in the form of a bad grade on a test, and at other times it was a blatant rejection or discrimination. Regardless, I never developed the coping skills that I needed to lean into the discomfort, but rather did everything in my power to make it disappear quickly. As the years went by, I became embroiled in the rituals of practicing medicine as an OBGYN physician and learned more maladaptive behaviors that would continue to buffer the stress of trying to balance work and life. While my story is not unique for overachievers, I was so deep in this reality that I began to wear it like a badge of honor. I suffered in silence with infertility and miscarriages for many years and would rub salt in my wounds by having to put a smile on my face and take care of pregnant women daily. Instead of embracing trauma, I pushed through it and continued to overwork and numb the pain. While most people embarked on their infertility journey with fierce determination, I found myself fitting my treatments in during my busy day. I would never dream of this type of schedule for my patient, yet somehow it was totally acceptable for me. Eventually, we were blessed with our children, but the stress of work and now family life took on a whole new form. My friends and family were in awe of how I was able to manage all the things. I would be able to work many sleepless nights and then go on to plan the perfect kid's birthday party. I took the accolades that were thrown at me as an accomplishment rather than the truth that my overloaded schedule was slowly chipping away at my physical and mental health. Slowly, I developed insulin resistance, borderline diabetes, elevated cholesterol, autoimmune thyroid disease, and gastrointestinal reflux, even though I looked completely healthy on the outside. Initially, I was very regimented with diet and exercise. And as with anything, if I worked hard enough, I was certain I could beat my fate. Unfortunately, that was not enough because of the constant stress and lack of sleep in the background. I tried every diet and healthy way of living. Subconsciously, I began to chase a number on the scale or a lab value to announce to the world that I had finally arrived there. I was certain if I accomplished this, I could finally relax and breathe a little easier. I found lifestyle medicine by accident. It started with a podcast about managing your health and by managing your mind. The message was clear. There was no quick fix or perfect diet to achieve the health goals that I was always striving for. It was all about putting yourself first and approaching your life from a place of love and abundance. This was mind-blowing. Never in all the years of my adult life did I put myself as a priority and truly practice acts of self-care. Slowly, I started noticing how my body felt with certain foods that I ate. If it didn't feel good, I would no longer indulge in it. Gradually, I moved to a primarily whole food, plant-based diet. And then with that, the next logical step was to remove processed flour, processed sugar, and the results were subtle yet utterly profound. The reflux, the brain fog, the hot flashes of perimenopause almost disappeared. I felt like I had discovered an ancient secret and I could not wait to share it with others. So my journey with lifestyle medicine, again, comes from a very personal place. And I struggled with PCOS. I struggled with infertility, the insulin resistant that kind of comes from chronic years of this. And I really truly felt like what I wish I had now, having indulged and immersed myself in lifestyle medicine, was the power of connection as one of the pillars of lifestyle medicine. The first step of this connection is the connection to self, the awareness, the understanding that there are certain health conditions that that may be in your genetics, or it may be related to your environment, or it is part of your hormonal health history that is going to be natural or not. But yet we have this awareness where we know deep down inside that regardless, there are certain behaviors, whether it's food seeking behaviors, whether it's sleep deprivation, whether it's just managing our mind and managing stress, that we want to be able to kind of become really granular and specific about and see if we can come up with an action plan to help patients figure out that it's the whole picture when it comes to how we're taking care of ourselves. So again, I speak primarily in the context of women's health and hormonal health because that's what I do. But I like to meet patients where they are and talk about, are you ready to change? Are you ready to make these connections with yourself? Because I'm providing a community and a support system in the practice that I'm in currently, where we get to work with patients in this whole new concept. And we talk about managing our brain. We talk about future self and goal setting. We talk about stepping into the lives of our patients and understanding what are their obstacles on a day-to-day basis and what's realistic and what's attainable. And then I literally come up with prescriptions. We come up with prescriptions for exercise and movement. We come up with prescriptions for sleep management. We talk about stress management and how stress plays such a huge role on our long-term health. I know yesterday there was a physician that alluded to that stress might be the root cause for a lot of cancers. And I know that stress plays a significant role on so much of our metabolic health. While it's hard to pinpoint and measure stress, the chronic fluctuations in our stress response definitely changes our body's way to metabolize glucose and creates a picture of insulin resistance that can lead to weight changes and weight gain, that can lead to an increased risk for obesity and heart disease and stroke and diabetes. So there's ways where we can find places to make some change. And that's what my message is all the time. And again, I didn't even know that this field of medicine existed prior to my own self-discovery, a few years back. And I'm so thrilled to be able to be part of this community that I'm in professionally, but also part of this community, this lifestyle medicine movement, because it's giving me the opportunity to let patients know that there's a way to think out of that fog that seems to happen where we feel like we're victim to our hormones, or we feel like we're victim to our metabolism, and we can't make those changes to be able to help ourselves move forward.
That must have been incredibly difficult for you to have suffered with fertility issues while being the doctor to people that were having babies. I can't imagine how hard that was.
It was, it was the culture and the time that I was in. It was not acceptable to talk about your personal stories. I had to have my game face on all the time. And so with that being said, I I did not know how to process my emotions. And that's such a huge component of really being able to move the needle and start making changes with your habits that can help improve your long-term health span goals. I didn't know how to process it. It wasn't something that people talked about. I just had to suffer in silence. And now, thankfully, that was a while ago, and thankfully women's health is having a moment right now. And there's conversations and there's social media and there's different platforms and outlets that are really, really highlighting some important, difficult conversations. So I do feel that there has been some forward progression in that area. But when I was struggling through those parts of my life, I felt, other than the support of my immediate, people, my family, my husband, I didn't feel like I had the right support system to go through that journey.
If it were happening today, would you have the right support system? And what do you recommend to your patients that have this issue?
Absolutely. I cannot speak again, highlighting the importance of social connection. And when I talk about social connection, it's not the mindless scrolling on social media. It's not, being parts of different Facebook groups. It's finding a connection in a way that really truly supports you, where that person, that entity, whatever it may be, is going to support you no matter what, and doesn't have the negative energy that you bring to a relationship, that really wants your best interest at heart. And I have an amazing support system. I always had an amazing support system. I don't think I knew how to articulate what my needs were. And that's another component of this journey, is having that awareness of, what, we all are going to struggle at different points in our life with different things and different health concerns, and we need help. And so having that internal awareness as well as having that external social connection and support group, I think, is so important.
That's great. Yeah, because yesterday one of the doctors was talking about how she's a trauma-informed coach, and fertility, when it doesn't go the way you want, that can be very traumatic for people.
Mm-hmm. Absolutely, absolutely. And so I have 3 beautiful children, and they are the reasons why I keep finding different ways to show up better, differently in my life, because I want to really give them the example of what's possible. And my journey from, where I started in medicine and to where I am now has been nothing but that. It's the possibilities are endless. And that's kind of been how I now really approach almost all things that I want to do with my career, with my professional life, as well as with my personal life.
I was reading in your chapter, and one of the things I really liked, and one of the guests yesterday talked about this too, is you have a passion for culinary medicine. How does that look in the world?
So my passion is, it's interesting. I have a family of 5, including myself, and 4 out of the 5 members in my family have anaphylactic food allergies. So it is, my passion for culinary medicine is trying to find ways to incorporate healthier options and sneak nutrition, really, really whole food, plant-based components without aggravating my family's allergy status. So I am always experimenting. Some things work out really well, some things don't work out so well. And that's kind of what my journey has been.
That's fantastic. Well, it's so nice hearing from you. And do you
Thank
see
you.
patients, do you take patients either virtually or in person where you live in Florida?
I do. So the platform that I'm currently with is called Alara Health, and it is a virtual platform. I currently see patients in Michigan and in Florida, and I'm in the process of obtaining licensure for California as well as Georgia. Alara Health is active. Our goal for the company is to be active in all 50 states. Currently, we're active in 21 states, and we take a combination of commercial insurance as well as a concierge-based service. And it is, honestly, it's a revolutionary concept in terms of really merging the concepts of traditional medicine as well as lifestyle medicine.
I'm curious, do you remember the name of the podcast you listened to that introduced you to the concept of lifestyle medicine?
Yeah, so the one that I listened to in the beginning was Katrina Ubel. It was Weight Loss for Busy Doctors. And somebody had mentioned that I should try listening to this podcast because she had done an episode on infertility, and she's very open about some of her journey and how she helps navigate difficult conversations with navigates difficult conversations within her coaching practice. And so I started listening, and I like it was almost like a whole world had been opened up to me. I could not stop consuming information. So that led to, um, you know, different forms of conversations. Either it was from Brene Brown, it was other physicians that were doing podcasts, it was everything and anything in between. I've listened to Dr. Greger, all sorts of different things, and along the way.
That's great. Well, thank you so much for sharing your story.
Thank you.
And now we have our co-host for this wonderful 3-day summit to introduce our next guest, Dr. Simran Malhotra.
Thanks, Chef AJ. All right. We have Dr. Renee Thomason next. So she is a triple board certified physician, owner of the Mind Gut Skin Academy, and a passionate advocate for women with chronic skin conditions. She was diagnosed with alopecia areata at a young age, so she understands the emotional and physical toll that chronic skin conditions can have. Dr. Thomason's personal experience inspired her to become the first graduate in her family. She completed her MSc and pursued medical school. Her expertise in family medicine, obesity, and lifestyle medicine allows her to help patients improve their gut health and lifestyle, and ultimately leading to a better quality of life. Her ultimate goal is to empower women to take charge of their health, feel confident in their skin, and build a supportive community. Dr. Renee is dedicated to using her knowledge and experience to help others heal and live their best lives. Welcome, Dr. Thomason. We're excited to have you.
Awesome. Thank you, Simran. Again, thank you, Chef AJ. I'm very excited about being here and speaking more about the book, but I guess more or less the book shares my journey, so I can just kind of talk about that. So I guess as of right now, I am like Simran said, triple board certified in family medicine. I'm a family medicine physician, also obesity and lifestyle medicine. So I kind of share the journey about how I end up getting certified in each. And I'm also finishing up certification in psychodermatology, which is basically focused on psychocutaneous medicine, just how the mind and the skin connect. So I was diagnosed with alopecia areata at the age of 8 years old. So I used to have long, beautiful black hair, kind of going down to the mid part of my back. And being raised in South Carolina, your hair was like your glory. It was like your crown. One day, my parents found a spot that was in my head, and we just kind of ignored it for a while. But then my primary care doctor made me go see a dermatologist. So I went to 4 or 5 different dermatologists before I actually got the diagnosis of alopecia. Um, it was traumatizing, very traumatic, being diagnosed with that at the age of 8. I felt like a piece of my identity was stripped from me. I went through, let's see, primary school, middle school, high school. I was getting a combination of treatments of steroid injections, and kind of at that time, it was like with this big old gun, they would like literally just stab me. It was traumatic every time I went. I cried. A lot of times when I went to the dermatologist, it was really kind of focused on treatment, but we didn't really talk a lot about my emotional health and my mental health kind of at the time. Um, every time I put the work in with the creams, with the steroid injections, with the oral steroids, my hair would grow back. I would feel normal. And then once we kind of backed up on the therapy, my hair would again come back out. And then I started feeling like the outcast, having a lot of the depression, anxiety, and that was never diagnosed in my youth. So I would say from middle school age going up into college, it was always this emotional roller coaster of just mixed emotions and loss of identity and trying to be like everybody else and not really feeling like I was heard, not by my doctor, not by my parents. Just having a lot of bottled up emotions. I didn't really know what to do with it. I was determined to be able to help people like me. So I applied to college. I was the first college graduate in my family. I was determined to become a dermatologist because, at that young age, I thought that I was going to like find this cure for alopecia to be able to help everybody. So fast forward, I ended up getting my master's in biomedical sciences because, I had to learn all the things in the lab. Went to medical school and was really excited when I was in different top dermatologist labs studying alopecia. Um, but I lost my passion in medical school because I saw that it was really more the focus of finding a treatment for alopecia. It's autoimmune. We still to this day don't really know what is the cause of a lot of it. There's a lot of postulated things, especially with it just kind of being an inflammatory type thing, but we don't have to get into the nitty-gritty with that. But at that time, I got really bored and really frustrated and didn't really see how it was going to help anyone like me because I was more interested in the mental and emotional part of it. And so I ended up changing my entire direction, ended up going into family medicine because I saw that on the family medicine track, I was able to see patients of all ages, still able to still see skin, still able to address mental health. So it's kind of like I went that route at the last year of my medical school. So everything that I had planned and prepared for at that time, like everything just kind of blew up, I guess. But fast forward, I end up finding a love and passion for dealing a lot with my patients that had a lot of skin conditions. They opened up to me a lot about their mental and emotional health. A lot of them started going to therapy because of me, was able to open up to their dermatologist more. I ended up graduating right at the height of COVID in 2019. I ended up doing hospitalist medicine at that time because I really got burnt out by the outpatient part. Um, and then COVID hit, and I was afraid for my life, especially working as a hospitalist. And my A1C was up, was diagnosed with cholesterol. Um, of course, my hair was not going back or anything like that. Stopped treatments because at that time, I think we had an FDA approved biologic to be able to kind of help grow our hair back. And it's kind of like I just put a pause on everything. Um, I became introduced to obesity medicine initially. I used a lot of the principles in obesity medicine to kind of apply to my own life. So really kind of changing my diet, really kind of using some of their principles. And that really, really benefited me. During the time of COVID, I also got introduced to lifestyle medicine. I was also doing I won't say it was like a podcast, but it was kind of like a webinar series with the National Alopecia Areata Foundation with a colleague of mine. And we had a lot of patients that they were not interested in a cure for alopecia. They were more interested in talking about alternative medicine, more interested in talking about the stress of how it is to deal with alopecia, how to live every day with alopecia, how to make better life choices living with alopecia. And that carried on to other chronic inflammatory skin conditions. So that opened up a view of medicine that I never saw before. So I listened to the podcast, plant-based, it was like from plant-based telehealth or something like that. And it really talked about lifestyle medicine, how changing your diet, et cetera, et cetera. So I initially got opened up to the community of lifestyle medicine. I ended up talking more about that with the autoimmune community. Ended up getting board certified in lifestyle medicine. Applied a lot of those principles, the 6 pillars, really to my life. And kind of off from there, I got introduced to the world of psychocutaneous medicine, where it was really talking a lot about how the mind, the gut, and the skin are connected. I mean, our skin being our biggest organ, and how our emotional health really changes the gut microbiome, and how that also leads to a lot of changes in gut dysbiosis, and how that leads to a lot of skin changes. 30% of most individuals that are diagnosed with a lot of chronic skin disease, they have an underlying level of depression and anxiety. A lot of that can lead to a lot of poor life choices. And especially as we're getting older in the 30s and 40s, that's when you start to also see changes in other aspects of your life. Diabetes, cholesterol, hypertension, all of that. So I felt that I was in kind of a unique position, especially as being a patient, as being a physician, being able to use evidence-based medicine and being able to feel great that I was able to be educated to be able to pull all of these principles together to be able to kind of help this population of people that have chronic inflammatory skin disease and kind of being an advocate for them and really kind of giving them principles that they can use in their everyday life to really kind of change their overall quality of life, because a lot of times there's no cure for our disease. It's just kind of something that we have to live with, but they also need advocates to really kind of say, hey, how you're doing? How is your mental health? How is your emotional health? Is there any medicine that you need? How are you addressing all of your other chronic conditions other than your skin conditions? And so I feel that I'm kind of that middle person, kind of to be able to kind of partner with different dermatologists and with different clinics to be able to kind of help this population A lot of times, when you're dealing with what is up under the precipice of psychocutaneous medicine, a lot of time the dermatologists don't have a lot of time to really kind of really sit and talk to the patient. So I just feel that that's a really unmet need that we have. And so I just feel that my heart and my passion has really kind of met to where I've met my tribe or my people to really kind of help make a difference in other people's lives. Um, so yeah, that's really kind of really what my chapter is about and really what it's about my journey. So I did come up with the Mind Gut Skin Academy, which really kind of initially focused on women just to kind of give them evidence-based medicine. And so that has now kind of, since I finished up some more training, I will be taking patients more in the fall as I continue to open up my clinic, just more really going to be more of a telemedicine clinic. Um,
Thank you so much. So alopecia is an autoimmune condition.
it is, yes, ma'am.
Interesting. So is there any way to prevent it before it happens? Like, does diet help at all? Can a plant-based diet help prevent it or treat it in any way?
Yeah, so not necessarily prevent it, because it is autoimmune. There's still a lot of speculation of the etiology of alopecia areata. A lot of things what we're seeing is that it is a Th17 like driven. I won't get too nerdy. Basically, how our immune system really just kind of attacks the hair follicles. But it's been shown that if you're able to kind of change to some plant-based, being able to really focus on some micronutrients, that it can make a difference, but it's not going to cure the disease. Yeah.
And there's a question from Julie. Is there such a thing as stress-induced alopecia?
It
She said a
is.
friend
There
of hers, it started the size of a dime and now is a quarter-sized bald spot. A prescribed cream didn't work, and the person isn't plant-based, eats a lot of fish, but doesn't eat processed food. Can anything help with that?
Yeah, I would say that there are, since this platform is not really for diagnosis with anything, I can kind of say that if it is something that she has, I would say I would recommend what I'm hearing is that it kind of started off as a quarter size and it kind of got bigger. That sounds more like alopecia areata, but she would have to go to a board certified dermatologist to be able to kind of get a skin biopsy to be able to kind of get the official diagnosis. And there are a lot of different treatments based on the type of alopecia that she has.
Do you see patients virtually or in person in your practice?
Yeah, I will be seeing them virtually in my practice more towards the fall as I'm just kind of gearing up, changing from a coaching based practice. That's what I have now with the Mind Gut Skin Academy to now to where I'm just kind of transitioning to allowing that to be my practice. So in the fall, I will be able to see patients in Virginia and the Midwest and working on my California license now.
That's great. Everybody's working on California. That's perfect because that's where I live. Do any of the doctors that are in the Zoom room have any questions for any of the doctors that have spoken so far?
I guess one of the questions I have is, Gori and I talked offline since we were getting to know each other, and I know her experience of being the doctor and the patient. And of course, Renee just shared her beautiful experience. I wonder, like, for anyone out there who's a healthcare professional, it doesn't have to be a doctor, just a healthcare professional who's also dealing with their own diagnosis or their own health journey, what is the one or two things that you would share with them that really helped you get through and continue to show up for your patients?
I would say for me, is that it's important to find your tribe, especially if you're somebody that has a chronic skin condition. Um, because I've learned that it's the support groups that really help me kind of deal with the emotional ups and downs with alopecia and to not really pay attention. I mean, you can be inspired by these Instagram influencers and all of that, which is great. But, I'm happily bald. I'm actually able to talk to you, but it took me a while to get here. So make your journey, and don't compare your journey to anyone else. But find that support that you may need. Um, That would be number one. And then number two is do not sleep on awareness. Be aware of your emotional and mental health, and do not be afraid to ask for help. Advocate for yourself when you're talking to your dermatologist or your family medicine doctor to be able to kind of address your mental and emotional health, because I mean that's the journey that you're on. As a DO, I'm really big on holistic health, treating a person, mind, body, spirit. So we have to treat the whole person, not just the skin condition. So I think that's really just about it for me.
Love that.
I love that. I agree. I couldn't agree more. I think the awareness is, really truly the first step. And then to the comparisons truly are, the quote, comparisons are the stealers of joy. And it's so true in these personal health journeys because there's no one size fits all diagnosis, there's no one size fits all treatment. Everybody's story is different. And so everybody comes to the table with such different unique experiences. And that's the key, is to kind of really find somebody, find a provider, find your team of people that can understand where you are, what you're coming, to the table with, what your challenges are, and then come up with a plan. And if it's not working, to continue to make changes, because that's where the power of this community and the power of lifestyle medicine and the power of taking control of your mental health and your awareness really is. Because if something's not working, you want to have the confidence that you can make other habits to move yourself in a different direction and create these long-term sustainable changes. So I couldn't agree more with what Dr. Thomason said.
Thank you. Dr. Thomason, we actually have one more question about hair loss. And since you're the expert, would you mind answering it?
Yeah, sure.
Thank you. And this is actually about hair loss and iron. And the person is saying if the ferritin levels are greater than 70, it's sometimes recommended in terms of promoting hair growth. What level of ferritin do you recommend to help hair? Mine is 11 because of heavy menses. How is it best to supplement? Is there truth to taking iron supplements every other day for better absorption? So I guess the question is, does iron help grow hair?
So I would really attribute, I'm not going to put this on the principles of giving out medical advice with a lot of things, because it's going to be individual, based on the individual and based on the labs. Because I think that a lot of times patients can get a lot of data offline, but it's not really kind of narrowed to them. So a lot of times with our iron levels, it can be correlated with alopecia, depending on the type of alopecia that you do have, but also depending on the lab values that you would get from taking those labs. But if you are iron deficient, that can lead to aspects of hair loss. So I would say make sure that you're getting your labs first to kind of give yourself a baseline and supplement if you need to at that time.
Thank you. So next is up Dr. Malhotra to introduce our next speaker.
Thank you, Dr. Gori and Dr. Renee. We appreciate you being here, and we have our next three speakers. So I will introduce Dr. Shruti Chandrasekhar, who I actually had the pleasure of attending a book reading with this weekend at the Green Fair Cafe in Virginia. If you're in the area, it is an amazing whole food plant-based restaurant. So just gonna put a plug in for that. Dr. Shruti Chandrasekhar is a triple board certified physician with expertise in internal medicine, obesity medicine, and lifestyle medicine. Understanding lifestyle factors in health and disease had long been an interest. After completing medical school in India, she graduated from Columbia University's St. Luke Roosevelt residency program in New York, where she was involved in a special project on nutrition and obesity. Upon completing her residency, she came to Virginia, where she has been a hospital medicine physician for the last several years, while concurrently pursuing her certifications in obesity and lifestyle medicine. She understands the challenges that one faces as a patient with chronic conditions. She comes to Zoe-style medicine with the right knowledge and understanding of the pathways to healing, and is here to support and recommend the best treatment to achieve one's goals. She joins a select few physicians across the country with such expertise and would like to make a significant impact on her patients and her community. Welcome, Dr. Shruti.
Thank you so much, Simran. And thank you so much, Chef AJ, for having us. Are we on? Yeah, okay. So before I go in here, I want to say how incredible it's been to listen to all amazing doctors. And I was just listening to Dr. Gauri speak, and she mentioned about PCOS, and that's where I have a little bit story of myself. Before I start dwelling more into my PCOS journey and lifestyle medicine, I would like to talk about me a little bit. I come from India. I come from a place called Bangalore, India. I came here 20 years ago, and I live in Richmond with my family as two boys and my husband. I did have a fur baby, but we lost him in pandemic due to cancer. In my free time, I do enjoy cooking now. Before, I actually struggled to cook, but now I'm loving and making the most of it from what I learned while getting certified in lifestyle medicine. I also enjoy hiking with my family, and I started to bike now because I struggle with exercise. So now with hiking and biking has been more natural way of bringing into exercise into my life. I practice internal medicine, obesity medicine, and lifestyle medicine. I have a practice named Zoe Style Medicine. It's been more over a year I've been practicing this, and I see incredible patients who have made a lot of changes since they're seeing us, and it's very rewarding. I have a wonderful team who helps patients make changes. Everybody is lifestyle certified. We have a nutritionist, health coach, and a whole stress management team with that. I do take all insurances, and I do see patients virtually all over Virginia currently. And before I go into my book, I would like to talk a little bit more about my family. My mom and dad, they still live in India, and thankfully they're doing well now. But I come from a family where heart disease is very common, like early heart disease. I haven't met my grandparents, I mean, my grandfathers especially. Both my grandparents were deceased by the age of 40, 42. And yeah, that's very scary. And when I was a little girl, my daddy at the age of 34 had a heart attack. And at the age of 44, he ended up having a bypass coronary artery bypass surgery. And yeah, it's been very scary since then. Sorry. And I also come from a family who has polycystic ovarian syndrome, that's PCOS. I think Dr. Gowry mentioned a little bit about it. And people with polycystic ovaries, it usually affects the women in childbearing age. And little was known before, and they didn't have any treatment plan for that. All we could do was simple medications, as it's been mentioned before, that it was not actually treating the root cause, but more like putting a Band-Aid on it. And I am one of those women who is affected with polycystic ovaries, and it has caused significant challenges during my childhood, and also during my residency, and also now as a doctor, and also as a parent. And the patients with polycystic ovaries actually have increased risk of insulin resistance from a very young age. So they are prone for becoming diabetic way earlier. And also they go through a lot of hormonal changes and hormonal disturbances, which can have menstrual irregularities, and they can also affect fertilities and also pregnancy complications. And they also suffer from increased risk of having anxiety and depression. And there are very little treatment options available before. So I'll go on and read a little bit snippet from my book. Mine is the chapter 2. I also have PCOS, which runs in my family and is a significant disease burden. When I was younger, I was told that oral contraceptive pills were the only effective treatment for this condition. But lifestyle was not addressed, which I know to be an effective treatment. While I practiced hospital medicine, I completely changed my lifestyle from healthy to one of convenience. I was eating a lot of takeout food as I had no time or energy or cook for myself. My PCOS got worse, which affected my energy and my sleep. I can say I was hardly thriving, but continued with my lifestyle. After a few years of this lifestyle, we decided to have a baby. With PCOS, conceiving was a challenge. Pregnancy came with challenges, as I had to be on insulin shots and keep a close check on my sugars for the rest of my pregnancy. Pregnancy made me think about if there was something else I could have done differently in my journey towards my first baby boy. The following 2 years held more challenges with a growing child, and I was fortunate to have another child. I was still trying to balance it all, but hardly succeeding. I couldn't lose the weight I gained this time around. I needed to be on insulin shots like my prior pregnancy. I managed somehow, but afterwards I was left with extra weight, extra responsibilities, and struggling to balance my life as a doctor and wife, and now a full-blown diabetic. I felt ashamed that being a physician, I couldn't take care of myself, and I couldn't take care of my eating or medicines like I was able to when I was pregnant. This time wasn't like a 9-month drill, but an uncertain timeline and unknown endpoint. I started to try the diabetic diet, and things got worse. To sum up my situation, I was a 38-year-old with uncontrolled diabetes, my HbA1c numbers in the 8s, and an overweight physician on 4 different meds for diabetes. I felt defeated. As my PCOS flared over the next few months, I had become severely anemic. I had to call EMS when I developed chest pain resulting from severe anemia. I had my babies with me, one 4-year-old and another hardly 6 months old, both looking at the EMS crew coming into our home as I was about to be taken to the ER. I remember looking from the stretcher at my son's face. It scared me. At the hospital, I was diagnosed with severe anemia and coronary spasms. I needed a blood transfusion, and I started on medications for my heart. I spent a night in the same hospital room where I treated so many patients, feeling crushed to be in this situation. I didn't want to accept the course of my condition and feel powerless. I knew I needed to change. The scare of almost having a heart attack and being diagnosed with a heart condition at such a young age caused me to panic, especially with 2 small children who depended on me. This is where I think the change started happening. This is the same time when Dr. Pradhan, who's editor of her book and also a wonderful friend of mine, mentioned that she certified in lifestyle medicine. I got curious. I'm like, okay, let me see what that is. And that's when I started looking more into that and started digging deeper. And then I learned so many things which I didn't understand how it could affect my life in such a huge way. I put in all those practices. Of course, it took a while. That was where a lot of the challenges came in. It's not only just learning, but also putting it into practice. That is where my patients also struggle in my practice. Anyway, fast forward to 4 years since then, I feel that my polycystic ovary have been well managed. For the first time in last 4 years, I haven't had any blood transfusions or needed to, go through uncertainty of what's going to happen. And I am still a diabetic, but well controlled. I am on one medication rather than 4 different medications, which was causing me a lot of horrible side effects. During this journey, I actually was struggling how to put it into act of how to live my life in a new learned way. And that is when one of the doctors called Dr. Pottery, actually, she has come on Chef AJ a couple of times, and she has taught me wonderful cooking skills. And also her blog has been like my Bible in my kitchen, and which has actually helped me make the transition into a more healthier, nutritional meals for me and myself and my family, and also in a traditional way, which is because that suits me the most. And I appreciate the support I got there, and also made incredible friends along this journey who are also in the same path. So for now, so far, I've had almost over a year of experience in practicing only lifestyle medicine. And I see quite a number of polycystic ovary patients, and I feel so empowered that I can teach them that there are ways you can do and you can take control over in your lifestyle, which can help you prevent the same path I've gone through. Probably they don't need to go through the, diabetes phase. Maybe they can, prevent themselves from being diabetic when they were pregnant, and that will help them feel so much more control over what they're doing. Yeah, that's my story. Thank you so much.
Thank you so much. And I just want to remind everyone, if you get the book, it's really cool. Each doctor, in addition to their photo, their websites, their story, there's a QR code. So you can actually use it to link to more information about them, their websites, sometimes videos. So get the book. The link is below.
Wonderful. Thank you, Dr. Shruti. And next, I have our wonderful Dr. Nandini Sunki Reddy. She is a family physician, board certified in obesity medicine and lifestyle medicine. She is the founder of the Style Your Health MD YouTube channel and a paid speaker. She is passionate about introducing patients to the fields of lifestyle medicine and obesity medicine and helping them take control of their lives. She loves speaking on stage and sharing her message with people even who are not her patients. She lives in Georgia with her husband and 2 children. So welcome, Dr. Nandini.
Hey, thank you, Simran. Thank you for the wonderful introduction. And thanks, Chef AJ. It's been an honor to be on your show. And I graduated from Louisiana State University. I'm a board certified in family medicine. I'm also board certified in lifestyle as well as obesity medicine. I live in Georgia. I lead a multidisciplinary obesity team. I have a dietitian, exercise physiologist, and a psychologist in the team. So we as a team help patients lose weight and feel great. So I see patients all throughout Georgia. I'm licensed in Georgia. So I work in Roswell, Georgia. So we see patients both virtually as well as in person. So I'm very passionate about the fields of lifestyle and obesity. I think they helped me a lot, like personally as well as professionally, to become a better doctor. So a lot of times when you're diagnosed with a chronic disease like diabetes, high blood pressure, heart disease, you're sold on the idea that you're stuck with this disease forever. No matter what you do, you got to take medications for the rest of your life. And this happened with my patients and in my own family. My father was diagnosed with diabetes at the age of when he was in early 30s. So, and he was started on medications, and one medication led to the other medication. And like, he was never, I mean, I've never seen a doctor sit down and talk to him about lifestyle changes and what you could do, what he could do better in his life to help with his disease. And nobody ever talked to him about these. So he eventually he kind of got an understanding that like, hey, no matter what I do, I'm going to be on these medications. So and eventually all the medications stopped working as usual. The progression of diabetes, as you all know, he ended up with chronic kidney disease, and he was in dialysis. And so he used to have peritoneal dialysis like 10 to 15 hours a day. So, and it made him severely depressed because he was more social and he wanted to travel around the world. He wanted to interact with people, but it made him homebound. And it was overwhelming to watch him go through this. And even finally, he passed away in September 2020, which was devastating. But after his loss, like I started thinking, where did we miss? What are we doing wrong? How could we do this better? And it became an internal mantra, like I should help as many people as possible, not to go through this. And when I discovered the fields of lifestyle medicine and obesity medicine, I was really fascinated to know more about this. I really wanted to know more about this. And I got certified in both the fields within 6 months while I was going through the loss of my dad, which was really a hard time. And I was normal grief as well as going through this board. So, but like after passing these boards, I felt more empowered to help my patients. My practice style shifted from a knee-jerk reaction where I would prescribe. I would be more than happy to prescribe, okay, your blood pressure is high, I'm going to prescribe one more medication to help your blood pressure. But my conversation kind of shifted from that knee-jerk reaction to, hey, what are we doing different? How is your diet? Are you sleeping enough? Are you exercising? I mean, what are the things you're doing lifestyle-wise? And I go through all the 6 pillars of lifestyle medicine. So, and over the years, I helped several people get better, get rid of their medications or lower the doses of medications, which I feel I'm really happy doing that. And one of the patient whom I really feel I've helped him was I wrote the story in my book. He's a gentleman who, when he came to me, he was on 6 medications, including 2 medications for his blood pressure, for his cholesterol, including his insulin. So he was in his 50s and he was depressed. He was like, "Doc, no matter what I do, I will be on these meds for the rest of my life." When I told him there is hope, his eyes literally lit up. He never heard this from any provider before. So I told him, "Hey, we're going to work with you. You're going to be seeing all these people, but we're going to work with you as a team to help you lower the doses of medications and help you have a more healthier and happier life." So we worked as a team. Our dietitian, she helped him change. He was a vegetarian to begin with, so it was not a hard thing to change from vegetarian to whole food plant-based diet. So we changed his diet, and our exercise physiologist kept him accountable and helped him how to take baby steps to help him exercise. And our psychologist, that was the biggest piece of his health, because food is an emotion. Food is not something which we eat to feel because we are hungry. So we in fact came to know that he was stress eating. So his mindset around food kind of changed. Eventually, a year later, he lost about 20% of his weight. And he was very happy to get rid of his insulin because he didn't need the insulin anymore. So, and his blood pressure medications, like the doses of blood pressure medications, drastically decreased. He didn't need that anymore. So I see him once in 6 months, and he's healthier and happier than ever before. And I wish we would have known about this lifestyle medicine 30 years ago. My dad would have still been alive today and not gone through all the chronic kidney disease, the progression of chronic disease the way he did. And he would have been healthier and happier and enjoying his years of retirement with his grandkids, traveling around the world. So definitely, lifestyle medicine has helped me to be a better provider, better doctor.
Thanks, Dr. Nandini. It's a very beautiful story, and can definitely see how you turned your pain into your purpose now. And wherever your dad is, we know that he's really proud of you.
Thank you.
Next, we have Dr. Wendy, all the way across the pond in the UK. So thank you so much for joining us, Dr. Wendy. Dr. Wendy Stammers is an NHS GP, Hero of Health Board Certified Lifestyle Medicine Doctor, Certified Health and Wellbeing Coach, mother of 2 gorgeous, very active boys, and a former GB age group triathlete. She is actively changing the way she practices medicine and empowering patients, using evidence-based lifestyle medicine to prevent, manage, and reverse chronic diseases. Welcome, Dr. Wendy.
Thank you so much, Simran. Thank you for that kind introduction. And to you, Chef AJ, thank you for accepting me from across the pond, as Simran said. Yes, I'm stood here at 8 o'clock at night, in the dark. Well, thankfully not in my room, but all the way from the UK, and I'm here in Sheffield. So thank you for having me. And as Simran shared, I'm a National Health Service general practitioner, which I believe is equivalent to your family physician. And I thought it might be a little bit helpful just to share exactly what that means, given that our health service is obviously very different to yours in America. So the National Health Service is funded by taxpayers' money. So that most of the health services are free at the point of use. And general practice is the first point of contact for most people seeking non-urgency medical help within the NHS. And we as GPs are the main gatekeeper to secondary care, which tends to be provided in our hospitals or in community centres. As GPs, we have 10 to 15-minute appointments to see our patients in, and they present, as you know, from anything from head to toe and everything in between that is non-emergency. And sadly, 2 out of 3 of our appointments now are being used to diagnose, manage, treat chronic diseases. And as we know, all of the speakers on this summit have shared that the majority of these chronic diseases are fueled by our lifestyle choices. And actually, to know that they can be prevented and reversed, it is a real shame that we are sinking under this pandemic of chronic illness. So I'm going to share a couple of excerpts from my chapter to first explain how I discovered lifestyle medicine and actually appreciate that it was such a thing. And then what gave me the courage, strength and permission to pursue it. And then I'll talk a little bit about where I am now. And before I start reading, I'll just share what my sort of upbringing was, I suppose, and how I've always believed in an active, healthy life. I was very privileged to have been brought up in a small country village where my activities were very much outside, running around, rolling around in the mud, playing with my friends, connecting in my neighbourhood, playing until 8, 9, 10 o'clock at night, driving my parents crazy, I'm sure, and always known as the child that never sat still. So I was always active. And I was also blessed with a mum who cooked home-cooked food. It was whole food, it was healthy. And so I was given a really great setup to life, and with absolutely no appreciation of actually the impact it had on my physiology and my biology. But now looking back, I feel so thankful that that was my start in life. And so I've carried that on throughout into my adulthood, and my exercise and activity has always been my go-to, my therapy. Every day, I'd be out running, and now it's very much chasing the kids. Although I did break my ankle in August, which did actually give me quite an eye-opener as to the really true saying that if you don't use it, you'll lose it, because that's exactly what happened to the muscle in my leg when it was put in a cast and completely immobilized for 2 weeks. So yeah, that was a really powerful visual for me. So yes, I've always felt that lifestyle is crucial, and at medical school you're taught very much about treating illness. You're taught about diseases, and you're taught about the medications that are needed to treat these illnesses. But I think at the time, I never appreciated that all we were doing is treating symptoms. And don't get me wrong, medications are lifesavers. But what was failed to really be drilled down on at medical school is actually the impact of lifestyle and how that can be the preventer and the reverser of these diseases. So I always consulted in my GP practice, always tried to bring in the elements of exercise and nutrition. And then I discovered that there was such a thing as lifestyle medicine. So this is the first excerpt that I'm going to read from my chapter. Just bear with me. Back in December 2017, my dream was ignited when I was travelling in my car and listening to an interview with Dr. Rangan Chatterjee on BBC Radio. He was discussing his book, The 4-Pillar Plan. That interview proved to be the turning point in my career. It was then that I realised where I truly belonged, in the world of lifestyle medicine. Dr. Chatterjee's words resonated with me, and the scientific evidence supporting his ideas was strong and compelling. I knew this was a field I couldn't ignore. I loved being a GP and helping others, but I'd grown increasingly frustrated with the system. I constantly found myself running behind schedule in my 10-minute consultations because I was more interested in helping my patients identify the root causes of their illnesses rather than just treating their symptoms with an ever-increasing number of pharmaceuticals. I firmly believed that many of the patients I saw were suffering from imbalances in their lifestyles, and that if they could be equipped with the knowledge and self-belief to address these issues, their symptoms would ease without the need for long-term or lifelong medications. Unfortunately, the constraints of the healthcare system, increasing patient demands, complexities, and lack of resources made it impossible for me to deliver this type of service within our practice. And now I'll go on to read the excerpt that gave me the courage, strength, and permission to pursue my dream. I'm so sorry. These were the 3 words that hit my husband and me when my friend broke the bad news in Sheffield Children's Hospital Emergency Department on the 23rd of December 2019. Oliver has a brain tumour. Our youngest son, age 5, had been having intermittent neck pains for the preceding 2 months, and then had the occasional vomit whilst at school. On that fateful day, we were all packed up to visit my family for Christmas, and Oliver vomited 3 times before we left. Our suspicions had already began escalating, and we were waiting for a brain scan. But now we couldn't wait. We drove straight to the emergency department, and that's where we remained for the following 2 weeks. I've just lost where I am there. Fortunately, sorry, just bear with me. I'm just going to go into rewind. Sorry, I just lost my train. It always still gets me to become a bit emotional. So our youngest son, aged 5, had been having intermittent neck pains for the preceding 2 months, and then had the occasional vomit whilst at school. On that fateful day, we left. On that fateful day, we were all packed to visit my family for Christmas, and Oliver vomited 3 times before we left. Our suspicions had already been escalating, and we were waiting for a brain scan, but now we couldn't wait. We drove straight to the emergency department, and that is where we remained for the following 2 weeks. Fortunately, we consider ourselves one of the lucky families, as Oliver's tumour was benign, a pilocytic astrocytoma. It took several months following his surgery, but he eventually made a full recovery, and today he's a healthy, active, and very fit 9-year-old boy. And he runs me round ragged. So, sorry about the emotions. After facing that really terrifying possibility of losing Oliver, I viewed life through a very, very different lens. And sadly, I feel it took facing that adversity to give me permission to pursue my true purpose, which I felt, like every single other person on this summit, was to help as many people as I could. So from there, I was brave enough to step away from my GP practice, which was very secure, and I delved into lifestyle medicine well and truly. So I binge read books written by world-renowned leaders in lifestyle medicine. I binge listened to podcasts. I was a complete bore to everybody because that's all I listened to and spoke about. And over that time, I then also became board certified in lifestyle medicine. Through reading and learning, I couldn't help but then live this life based on the 6 pillars of lifestyle medicine. And a big part of what happened in our household was to convert over to a pretty much I say 95% plant-based diet, having read all the evidence and listened to the amazing Professor Tim Spector talk about the impact on the gut microbiome and the effect that COVID had on the gut microbiome, and the direct connection with ill health and the severity of and morbidity of patients suffering with COVID. So we lived the lifestyle as well, and I certainly couldn't believe the impact on my energy levels. My husband, who suffered with microscopic colitis, so really inflamed bowels and distressing symptoms, we had to work really carefully with him and gradually introduce the different foods that he always felt as though he was intolerant of, or that gave him bad symptoms. But actually, we realized that these were the foods he really needed to heal his gut. And he absolutely has. So he's eating the beans, the legumes, the lentils, the onions, the garlic, those foods that often get blamed to irritate bowel. And, you know, we are packing our days full of fiber. And we know that that is one of the big things that that drives our healthy gut microbes to keep us well. And my kids absolutely love just adding up the number of plant points that we've eaten in a day. And there's often a little bit of sibling competitiveness as well in the household in relation to that. So during this time, I had the privilege to meet Dr. Linda Mizzen, who's an emergency doctor in Sheffield, and also Dr. Adrian J. Kumar, who's a GP here in Sheffield as well. And they're both board certified lifestyle medicine. They certified a good few years before me. And we quickly realized that we shared this amazing energy and real belief that this was the future of medicine. This needed to be out there for our patients. We needed to, actually facilitate our patients to take ownership of their own health. And we refused to just sit and spectate this complete explosion of chronic disease that was massively affecting our patients, but also causing our poor healthcare professionals and the health service to sink. So we then put all of our efforts into creating and founding Hero of Health. We've got 50 years of clinical expertise between us. And we founded Hero of Health that is basically a digital lifestyle hub that connects people within the community with their GP practices, and we are able to offer the elements of lifestyle medicine to our patients, because this isn't available in the NHS here in the UK. As a GP and working in different practices, I love working in practices that we are actually helping, because I'm able to tell my patients, yes, there's a walk, or there's a cooking session, or there's these elements of lifestyle medicine there for you to learn and actually take ownership of your health. And so what we do is the big focus is on connection. We have appreciated that 1 in 4 people report to being lonely. And loneliness, lack of social connection has a massive impact on our health and our ability to actually make healthy lifestyle choices. So we get people out, we get people walking and talking together, we reduce stress, we bring in strengthening and stretching exercises as we're walking and talking, and the results have been phenomenal. We've got 50%, we've got an equal share of men and women, and people just keep wanting to come along to our walks. They're spreading the word to various different GP practices that we haven't managed to get into yet. So it's been an incredible journey. We started walking with our patients every single week, all in our free time 2 years ago, trying to create the model, trying to work out the behavior, bring in behavioral habit change, coaching. That evolved into running some cooking courses where we're actually now really seeing patients reverse their chronic diseases. And just to finish on, just a couple of case studies. We've got, I'll talk about our wonderful Jeff, who's an 80-year-old gentleman who came to us having lost his wife. He became really isolated, lonely, lost his complete zest for life. He lost his why and his purpose for living. His daughter lives in Holland, and she was extremely concerned about him. He signed up to one of our walks because we were delivering walks in his GP practice, from his GP practice. And he was so frail to begin with. He didn't feel as though he could walk very far. But what we saw was a little sparkle each week igniting, and he came to those walks. We went at his pace. The whole group goes at the pace of the person who is least able. We all support each other, and the onus isn't on yomping over the hills. It's about actually teaching people and learning how to walk properly and engaging our muscles, talking about muscle health and strength and the impact that has on your longevity. And we do some gentle isometric exercises and some stretching. And we follow that in a cafe with a cup of tea, typically British. And we continue our coaching conversations in really listening to people's why, their purpose. What is it about, gaining health that will mean something to you? Why do you want to become healthy? And as soon as you tap into that and people feel heard and listened to, not judged, cared for, their mindset shifts. They trust us, they feel they're able to share, and we can really see those results coming through now. And this gentleman was insulin dependent diabetic. His blood sugars were through the roof. He was on 120 units of insulin a day. He could we do a chair sit stand test to see how many sit stands you can do in 30 seconds as a gauge of strength. And he could do 9 in 30 seconds. In just 8 weeks, he's gone from a chair sit stand to from 9 to 14, which has brought him from below average to nearly above average for an 80-year-old, which significantly reduces his risk for falls. And his insulin has dropped from 120 a day down to 64. And he said he never ever believed that he would ever reduce his insulin. And now he's actually believing that he can come off it. He's lost weight, he's smiling, he's hugging, and he's with us for life. And we've got multiple similar stories that I could share and keep sharing, but I realize I'm probably have had my little time slot, so I should stop there.
Thanks, Dr. Wendy. That was incredibly inspiring. And all three of you guys shared such personal journeys, and we are so grateful for your vulnerability. One of the things that you all kind of hinted to was the power of plants. And one of the things that I feel like I'm always asked when I tell people I'm plant-based is, oh, it's expensive to eat vegan, or it's expensive to eat plant-based. Maybe one of you, Dr. Shruti, maybe can you comment on maybe eating plant-based on a budget?
Absolutely. Thank you, Simran. That's a great question, because I do see some of the people in my clinic who did have financial issues. There's one of the patient I did mention in my book. She's a great example, and she inspires me. It's a little snippet I'd written that she came to me in the beginning for the group classes, and that time she's a lady who had actually had a bypass surgery and then had a lot of multiple medical issues, but she ended up regaining all the weight, and she's on food stamps, and then she's on disability, and then she was really struggling to make it end meet, and she would run out of the food, and then she in spite of all of things, she was gaining weight. She had gained like 150 pounds over after she had lost all of it. And then after she came in, she went through all of her lifestyle coaching. She came through just to sit through and she was making notes quietly. She didn't want to see any of us because she couldn't afford. That's what she said. But we are like, okay, let's see. And then she met with me finally, and she shared that she is already making some changes. She said that I really can't afford all the food, which we can go every week and go buy fresh fruits. Then we talked about like frozen foods, frozen fruits, and some of the frozen broccoli actually have more nutrition than regular thing which we buy from them. So she invested her time in portioning her food. Like she started bringing a lot of more for oatmeal. She would just eat oatmeal and she wouldn't add berries because it was so expensive. Now she goes and buys herself a lot of berries and she portion sizes and she eats with the oatmeal and she makes it more nutritious. And same way she includes like all of the vegetables. Like she buys all these tiny carrots and then she eats the same carrots for that week, but she's eating the amount portions. But next week she goes and spends on broccoli, and then the next week she goes and spends on oranges. So same way she is like able to include more of that, and then she's made tremendous changes. She's come off of medications. She's lost like so far 60 pounds in last 6 months, and continue to eat on budget. And then I also have another patient who is not that economically challenged, but she is so depressed and she does not have energy to go shopping. And she used to struggle a lot to include plant-based things. So we went through this ACLM, which was a food as medicine jumpstart, and she started incorporating smoothies. Even for that, she started buying ingredients, through the, what do you call it, like Instacart. She didn't want to go out and do things, but she started doing one smoothie a day, and then she started feeling the energy difference. And now she goes for shopping with a neighbor. Apparently, that's one of the social connections she developed because she started feeling good. And now both of them, share the recipes to make smoothie, and also they're able to afford it because most of the ingredients they can portion it out and then able to include that in day-to-day life. And also she started, we went through some of the teachings where we could do the meal makeovers. Like before, a lot of patients, even though they were like inspired, they didn't know how to make each meal nutritious, So she started adding in, like one day one of the examples we had was like, say that you go to a party which has pizzas. She would eat like pizza and like breadsticks, and that would add any nutrition to it. So we started making that same plate. Like, we go through the plate of the jumpstart, which is like we divide the plate into half of the fruits and vegetable, and 1/4 is the protein, and 1/4 is the healthy grains. So she started making that each meal wherever she goes. So she would just take a pizza into like 1/4 portion, and then she would fill in a lot of her half of the plate into a lot of vegetables and a lot of salad patties and all of that. She would put it in, and then in the 1/4 she would just skip and eat just some of the tofu if it's available, or just skip that portion, and then she would not feel that she's missing out and eating out in with the group, but she's still stuck to the same plan. That was one of the ways she was started eating healthier in each situation she was in. And I don't know if Dr. Sankirati wants to add something in for this.
Yeah, I think Shruti, you told most of the important points, and I think one of the other thing, like my patients have a challenges with they're so busy. I mean, most of the people around here are like both the husband and wife are working, and they have 2 kids, and they're juggling with time. So a lot of times, like we teach them how to meal prep, as well as if they want to incorporate more veggies. Now, most of the grocery stores around the United States, they do sell like packaged salads. So they are a good way of. I mean, you can get like 4 or 5 packs of frozen salads, and you can put it in the fridge. And whenever you have to, you really don't have to think a lot to make a salad. You already have a ready-made salad, so incorporating that can help you. And I always tell the patients, like if you eat a salad and with a fruit ball or something, and then eat your rice or pasta, you're not going to eat as much because the salad kind of fills your stomach. So that helps a lot. with most of the patients who have struggled with time and.
Thank you. Dr. Wendy, there's a question for you in the chat from Nadia. It's based on your beautiful purple shirt. And she says, I would love to join the Hero of Health Hub. How can I do that? Where can I do that?
Oh, that's wonderful. Thank you. And thank you for the comment on the purple. We do love the purple. Yes, it's very simple. You can look at our website. It's heroofhealth.com. Sorry, can you see it?
Yes.
Heroofhealth.com is our website, and you can find us on LinkedIn with the handle Hero of Health. And our email address is hello@heroofhealth.com.
Thank you. You know, in the book, guys, at the end of each chapter, there's a lot more about the practitioner, and you have so many interesting certifications. Many of them I haven't even heard about. Like, for example, you're a registered yoga teacher. I'd love to know what kind of yoga you do. You're a CrossFit level trainer. You end your chapter saying 20 years of making health fun and easy. But some of these certifications, certified trauma-informed professional coach. That's very interesting to me because yesterday one of the doctors said that she did trauma-informed coaching. And here's one, advanced certification in feminist coaching. So could you talk about some of these unique certifications that I don't think a lot of people might be familiar with?
Are you talking to me, Chef AJ?
Yeah, aren't I? I thought that was you.
No.
Dr. Wendy, that's not you?
Oh, there is another Wendy. There's another Wendy.
No, I'm reading the
Yeah.
wrong Wendy. Help!
I would love to have all that accolade of
Is she coming on, Dr. Malhotra? Is another Wendy coming on? How could I have
I
them?
don't think we have that, Dr.
Well,
Wendy.
the problem is, Dr. Wendy, you didn't put your last name in your Zoom name, and so I just could only look up Wendy. So what is your last name so I can look you up?
Stammers, and I think I'm chapter 30. I think.
Oh no, what a faux pas I made.
No worries at all.
How you think there wouldn't be that many Wendy's? You
Well,
know what's interesting,
I
though?
don't know any other Wendy.
Did most of you meet each other at the American College of Lifestyle Medicine conference?
Not really, but we did the boards together. Dr. Shilpi Pradhan, Sabha, and there is Dr. Gutkonda. Most of us did the boards together, the lifestyle medicine boards together. That's how we know each other. And Dr. Shilpi Pradhan was the one who compiled all these stories. So,
And I managed to squeeze
Yeah.
in. I managed to squeeze in there because I think I must have been on the American lifestyle medicine Facebook group, and I just so happened to see Shilpi's post about the concept of writing a book with all our stories, and I thought it was such an amazing idea, and I thought I had no chance, but she let me in.
Okay,
Yeah, that's me.
Founder.
I found the correct Dr. Wendy right here, and you have many interesting things about yourself. And oh, triathlete, that's pretty cool.
Well, used to be former.
Yeah.
But even then, I remember talking about because you get such an array of shapes and sizes doing triathlons, and how, you know, impactful doing those kind of sports can be on your health. It was amazing.
That's great.
You guys all transition more to a plant-based diet, it sounds like, after you discovered lifestyle medicine. And one of the things, you know, when we discover something we want to do for ourselves, it all makes sense in our head. And then you go home and you try to, you know, explain it to your partner, what you want to do. And then your kids, perhaps if they're older, and they're all like, what are you talking about? Why would we do that? And so one of the things I always like to talk about with my clients and my patients is, okay, here is how you can talk to your family about it. And maybe just in simple terms, the benefits of a plant-based diet, or simple ways that we're going to move towards eating more plants. Do you guys have any tips for people out there who want their families to join them in this plant-based world?
So, yeah, Shruti, you can go.
Okay, thanks, Nandini. Thanks, Simran. That's I think you shared a little bit of your journey and then your cooking things when we met in the Green Fair. We do not have Green Fair much here, kind of restaurant for me to add in, but I've always been a vegetarian, so it wasn't going more plant-based. It's just including more plants. That was like uh, initially I was like, okay, I didn't have any much resistance in my family as such. My kids were tiny, little, so they didn't have much control over what they ate. But yes, they are challenging now that as they're growing and they see the way other people eat in school and cafeteria. That's been a issue. But what has helped in my family for us is actually making more varieties and making it more fun. Beans was not something, green beans is not something which anybody liked in my kids, but now we make it in so much easier and fun way. In fact, we did have a family of four who had come in, and the kids did not like any vegetables, but we microwaved it in a like long string beans, and we started with a little bit of garlic and a little bit of salt, and then it felt like a sticks. They would call it like a green fries, and then they ate it and they were like, they loved it. Now mommy is like, how did you make it? And then we including that in her apparently one of her favorites right now. But I think for us, we struggled more was I'll talk about Indian food before, like I think in the ancient India, when they would eat, I think they were eating more like the way we are eating in plant-based whole foods method. But now things has changed, and all the portions has changed. It's become more processed carbohydrates and processed food and very little of vegetables. But I think for us in our family, we have gone more towards like we cook without oil, and we make a lot of different kind of vegetables. We go more varieties, so we do make it very similar to what Asian Indians would eat. And now it's become more of colorful for them, so they enjoy. My kids and my family, they love that. They feel more fuller rather than before they would eat a vegetarian meal, but it was not a well proportioned. They would be constantly considering of feeling hungry. But now including more of like sprouted lentils and sprouted bean sprouts and all of this, it is filled in their things, and they found it like really crunchy, and the taste is more fun. They're more welcome to add in those things. And also if they don't feel hungry, that's why they feel like, oh, okay, even though I'm eating only plant-based and more of vegetables, I'm more full. And then even when we go on vacations now, we stop in a grocery stores and we buy all these tiny food packs, which is all tiny cute. They make this really nice carrots, tomatoes, and broccoli thing, so we just carry it on, and that's their snack, instead of like asking, mommy, can we get a fast food or anything. So it was well taken in our family, and then we all are eating a lot of vegetables, more than when we used to eat just, even though we're vegetarian, this has been more plant-based whole foods focus. Yeah. Want to add something in,
I think something that my children really enjoyed was we create at Hero of Health, we created a fiber chart, and kind of divided it between, in terms of the legumes, the different vegetables, the fruits, the nuts and seeds and those kind of things. And actually I have that up on our whiteboard, and they're often actually adding up and calculating their fiber content. And we've tried to look at trying to aim for at least 40 grams of fiber a day. And again, like you, Shruti, with the colors of the rainbow. Have you had a yellow? Have you had a green? Have you had a red? And looking at the real varieties, and I'm even catching them now taking photos of their colourful plates and actually really owning it and feeling proud, and bringing them into the kitchen and them cooking themselves. And we talk about, actually eating in abundance. There's such a reductionism mindset out there, and everybody is feeling like they're on a diet, and we're constantly saying, what more can we add? So what else can we add there? And oh, have you had your broccoli, or your arugula, I think you call it over there, whereas we call it rocket, and that eating in abundance and variety and color, I think has been really helpful.
Yeah, I think my kids would love French fries, but when we made the sweet potato fries, the sweet potato fries with seasoning, they really liked it.
Yeah.
And the chips, if the kids love chips, but you
Yeah.
can the same kale chips in the air fryer and it tastes good.
Yeah.
So, and the rainbow, I agree with the rainbow because kids love having colors in their plate, like we all do as well. I mean, now I'm such a salad person. I want to eat salad every afternoon. I mean, my lunch, I really want to eat salad. If I don't eat salad, I miss something.
Yeah.
So that really helps. Like, I mean, and the days when I don't eat salad, I feel the difference in the way my body feels. Like I feel exhausted.
Yeah.
Yeah.
Yeah. I think the other thing that I've demonstrated is it's been such a massive learning curve, and I didn't know what a whole grain was when I came on this journey. I had no idea. I didn't, you hear it, but I had no idea. And actually finding them was impossible in our supermarkets. And so once I gathered them and actually showed them the contrast between, you know, really sort of refined oats compared to the full oat groat, and actually looking through those stages of processing, we open those conversations up and we talk about the acts of processing. And just in the car drive on my way home this afternoon with my youngest Oliver, I asked him what he had at school because he had a school lunch today. And he said he's opting for more plant-based foods. You know, when he has a school lunch, we can control it at home, but it's when they go to school, it's more difficult. And then I said, and was there a pudding? So he had a vegetarian pasta, and then they gave a cookie. And he said, I just took one bite of it and it was disgusting. And I was like, what made it disgusting? It was so sweet. And actually talking to them about the change in their mouth microbiome and the change in their taste buds. And I said to him, why do you think that is, Oliver? He said, well, because my taste buds are changed. I don't like all that sweet stuff. I'd prefer an apple.
Yeah, actually, I've seen that happen. Like, I mean, typically it takes like, I always tell my patients, it takes 28 days for your taste buds to recycle. So, and a lot of times I even realize this, like people, the sleep also makes a huge role in the food what you eat the next day. Because if you don't sleep well, the next day you're going to crave for more carbohydrates, more sugars, and more salty food in your diet. And because your ghrelin level, the hunger hormone level, goes off the roof. So if I see patients who are craving for like salty foods and unprocessed sugars, and like, I mean, I want to eat more rice. I mean, you have to think about the underlining. Like I ask them like how their sleep is. And most of the time, the sleep plays a major role on your food choices the next day. So if you sleep well, then you tend to make healthier choices the following day, and you have more energy to exercise, and you have control over your mood. So I mean, if you're craving for all those things, watch out how you're sleeping. So
Yeah. Great point you mentioned about sleep, Nandini, and also you talked about mood too, right? Like in that, I want to touch a little bit on how eating a plant-based, high fiber food can help your mental health as well. I do see quite a bit of patients who do have a diagnosis of anxiety or depression. A lot of people are on medication like SSRIs, where they're trying to lift up the hormone serotonin to feel good. So that's when one of the focus I started talking about is like how we eat a whole food plant-based diet, usually, which is so rich in tryptophan, like increased fiber, which gives you the good gut and brain microbiome and the gut and brain relationship. More you serve your stomach, like the more you eat the plant-based food, which is so rich in tryptophan, you do have the tremendous tryptophan, which converts to serotonin in your brain, which gives you a happy feeling, and then it does help you in improving your mood. And then that's when you start making more healthier choices. It also helps in a lot of way you feel during day, and also it helps you increasing in exercise and the whole mood. So it's one of, I don't know, for me, nutrition and especially increasing plant-based is like one of the root causes of changing the way you are. It increases your mood, the way you feel, that makes you feel like exercising more. And then when you exercise more, you feel like okay, you'll be tired enough to sleep. And also like when you're feeling well, you tend to make a little bit more, tend to reach out and make more social connections as well. So it's,
Definitely. Yeah,
yeah.
actually, there was this Harvard study which was done. Like, I mean, people who eat more unprocessed food, they're more depressed. I mean, you can see like people who eat more fast foods, they're extremely depressed. So, yes, definitely the mood is affected by what you eat.
Yeah, exactly. A lot of my patients, since I do get a lot of obesity medicine, I do get a lot of patients who are trying to lose weight, and then the first thing they come again, as you said, sleep, everything. When we evaluate, and I do a lot of pillars which needs to be optimized, and they're still struggling though. They're not able to do this, they're not able to do that. But one of the things we start like one meal by meal, and they talk about like, oh, I haven't lost any weight. I haven't lost any weight. They come back after a couple of weeks and stuff. And then I'm like, how do you feel generally? Like, I know you're doing these changes. Like, yeah, they switched from eating, like going from like eating like full American breakfast of like, or in Southern breakfast. And then they start making like overnight oats. They're like, it feels good, yes. And they keep doing it. So our goal is to eat the overnight oats, like, which is rich in a lot of fiber, a lot of nutrients, like antioxidants. And then they come in and they're like, I didn't really lose weight, but I'm like, how do you feel otherwise? Actually, I've never felt this good. I've never felt this clear. The fog is gone, and I feel like eating it every day. And then actually, even though my kids are noticing that I'm feeling more energetic, and they're going for a walk more. So I'm like, there it is. So weight loss will come later, but this is which gives you a lot more, sustainable energy to continue to do what you need to do for weight loss. That's where we kind of go
Yeah,
in.
that's true. That's definitely true because I mean, weight loss is not just something like, hey, because a lot of times, like practitioners, as we practitioners, we always tell, hey, eat less, work out more, you're going to lose weight, and that doesn't happen that way. There are a lot of factors which go into effect. And I have patients like who drink alcohol, who smoke, and who do all kinds of stuff like eat out every day, and they're like, okay, well, I'm taking this medication. I'm as obesity medicine prescribers, we do prescribe GLP-1s, but like the thing is, it's overall. I mean, it's there are a lot of things which go inside in the weight gain part. So you definitely have to change your diet. That's the number one thing, and you definitely have to exercise and keep your stress under control, because a lot of times, like your stress increases your cortisol level. I mean, a lot of times you can't control the stress, but the way you react to that stress makes a huge difference.
Yeah. And then when you eat a lot of this, say when you eat an apple, you can control the stress much better than when you eat a fry.
Right.
Yeah. It's so funny. We talk about fiber so much, and my son, who's like 5, and he starts reading, he likes to drink kefir every day. I don't know why he's stuck into calories. I never count calories. Now he's like, Mama, this is this much calories, and it has only 1 gram of fiber. Is it good? I'm like, we can go up on the fiber by eating something. Yeah.
Yeah, and
We
people do
often
think that
share.
Diet Cokes are much healthier than the Cokes, but unfortunately, the Diet Cokes are even more dangerous than the Cokes. So,
We
yeah.
often share with our patients that there's the saying that if you have small, hard poos, you have to have big hospitals. But if you have nice, big, large, soft poos, you can have small hospitals, just because of that impact on our health. So, and going back to the brain gut axis, we know that 90% of the serotonin that we release actually comes from our gut. And which is fueled by feeding our gut bugs. Those good healthy gut bugs are the things that will release that serotonin. So that was massive when I understood that. I always just thought that it was released from the brain, and that was where the majority was. So another indication and a visual for patients to appreciate actually feeding your gut, creates that serotonin to lift your mood.
Absolutely. Yeah.
So beautiful. Thank you guys. Those are all really, really awesome tips. We have our next speaker here, but is there any final words of wisdom that you guys would like to share based on your journeys?
So a lot of times, like, I mean, you never get time to make healthy changes. You just have to make time. So
That's a great point. We all have the same amount of time in a day, but what makes the difference in our lives is what we do with that time, right? So that is a beautiful distinction.
Yeah, I think for my last note is like, yes, sometimes we do fail. During those days, we just have to say that it was just a bad day, not the whole journey is gone, and start back again fresh next day. And I've gone through that myself every day. And then I'm like, okay, it was just a bad day, and tomorrow start fresh. And then that's it. Yeah.
I think for me, it's very much, sorry, Chef AJ, is just think about what you can add. Really small steps. If you're thinking about, eating that piece of cake, don't tell yourself not to. Have something high fiber first. Get into those habits. Have a pear at hand. Have some raspberries. Have something fibrous beforehand, and then have the pear, and then have the cake if you want it. Your body is prepared. The gut is lined. You won't absorb as much of the sugar, but also you'll be fuller, and you actually may not want that piece of cake, eventually. But add more.
We have a question from a live viewer from Susanna, and any of you or all of you can ask it. And she's wondering, do your families eat healthfully? And if they do you have any tips on moving teens and young adults towards this way of eating? It's not easy when they're older.
Great question. I don't have older kids, but in my practice, we do focus on family, family well-being, and we do focus on meeting the patients and the teen together, in shared medical appointments. And that is like, I think most what has helped is like education. I think when we educate it and then understand what are the benefit it has and what are the harms of not eating the healthy ways, actually one of the changing things which I feel has made a big difference. And also when a parent is making the change and slow by slow, they're more welcome to question, and first they might reject it, and then seeing that, parent is doing it, they get inspired to try changes. And also another thing is not making like, I wouldn't go it like, you need to stop eating this, rather than like, why don't you try this too along with that? Say that if they want to eat a French fries with that, like, okay, I have a side salad too, like Wendy was mentioning, high fiber first and then a cake. It's most of it is like when they're trying to introduce along with what they were doing it. Like say that they would go to one of the patient did have like they would only eat like potatoes for breakfast or something. So along with that is one of the things of changing into air fryer helped one, rather than like frying the potatoes or like hash browns, and adding in more of their favorite vegetable to one of them and making it more creative way actually has helped so far. That's all I can think from the top of mind. If at all other two has to chip in.
Yeah, and I think kids do change by observing the parents. So the parents have to change first if you're trying to deal with a teenager, for sure. At the same time, trying to replace it instead of if they're ice cream eating, try to change to frozen yogurt and things like that, where you're not taking away an ice cream from them, but like you're replacing it with a healthy option. So a lot of times, like if they're eating a lot of rice, replacing it with quinoa and with all the veggies, and like trying to teach that way, like where you're not taking away their favorite meal from them, but like replacing it with something else kind of helps.
Yeah, I love that focus on an abundance mindset, focus on all the things we can eat. I think I heard Dr. Wendy talk about plant points in their house. We have something similar. We have rainbow charts. So we have like this chart for the whole week with every different color of the rainbow and different foods that the kids can eat of the different of the rainbow. And it has literally become a competition in our house of who can get all of the 7 colors. So it becomes fun. It does take time. It's not easy, but it's worth it.
Yeah, I feel the competitive strain there, Simran. We have exactly the same, but it's fun, and also like Nandini said, it's small steps, and people don't want to be told what to do and what not to do, but those suggestions of actually, you want that packet of crisps, I get it, that's what we've had before, but what can you eat first? Can we cut up some carrots and have some hummus, and what actual plants can we eat first, and what does that food look like? Is it real food? And just start those conversations, and small little snippets of what real food, the benefits of real food.
Yeah. And kids are just little adults. I mean, they want just as much of a choice in what they're going to eat, especially after the age of, I would say, 5, as any adult. So I think the more you involve them in the process of what you're going to be eating as a family, the better it's going to be, because maybe they're just not in the mood for tofu today. Maybe they want mac and cheese. So find a good vegan mac and cheese recipe and make it together, and it'll go much easier if we include them.
Yeah, completely agree.
All righty. Well, thank you guys, Dr. Shruti, Dr. Wendy, Dr. Nandini. This was awesome. You guys shared some really, really insightful and important information, especially about the power of plants and how to incorporate it into our lives. So we have our next 2 speakers here, and I would love to introduce Dr. Mithika Kanabar. Dr. Mithika Kanabar completed her fellowship in addiction medicine at the prestigious Stanford University. She is a triple board certified physician in addiction medicine, lifestyle medicine, and family medicine. She is dedicated to improving the lives of people with addiction and providing holistic care in recovery. She currently practices addiction medicine and lifestyle medicine in Southern California. She is an international public speaker on various addiction topics, including alcohol use, opioid use, gaming, digital overuse, and aspects of our relationship with food. Being motivated by yoga philosophy, Dr. Kanabar is an avid gardener and proponent of leading a balanced lifestyle. So excited to have you, Dr. Mithika. Thanks for being here.
Thank you for having me here today, Chef AJ and Dr. Malhotra. Such a wonderful opportunity.
You were muted. And also, doctors, please always tell people where you're from, your websites, if you take patients in person or virtually, and any social media handles as well, because we can't fit everything in the show notes for each one of you.
Absolutely. Thank you for reminding me of that. So I currently work in Southern California. I'm a part of the Southern California Permanente Medical Group. So I work for Kaiser Permanente. And I have an addiction medicine practice, and we also have a lifestyle medicine practice with Dr. Lavenda and Dr. Karanam out here in Lancaster. And we are always open to patients who are in network, who want to get more help, whether it is with lifestyle or disease modification, as I know several speakers have discussed already. So in our program, patients go through a 10-week course of topics on lifestyle medicine, and they move along that and also get one-to-one consultations with MD, so which is a fantastic opportunity. And as far as addiction medicine is concerned, we see all issues related to addiction in our outpatient practice and then refer them to care as need be. My social media handle is at Kanabar MD, both for Twitter and Instagram, and I'm also on LinkedIn. Website for me will be mithikakanabar.com, which is first name, last name.com. And email is mindsatwa@gmail.com, and I can put that in the chat or in the notes later. Thank you very much, Dr. Malhotra, for this opportunity. I would like to take some time and talk about my experience with lifestyle medicine and involvement with the book that Dr. Pradhan has so nicely compiled and created, and what a wonderful journey it has been. I'll read a few lines from my chapter, and it's called "So Where Do You Get Your Protein?" because that's essentially what we hear anytime we talk about lifestyle medicine. It is more preferable to do your own responsibility imperfectly than others' responsibility perfectly. And this is from one of my favorite books, the Bhagavad Gita. And the reason I begin the chapter with
Yeah.
this is we will talk a little
I'm
bit more.
sorry. I'm sorry to interrupt, but people are saying your sound is muffled. So like when you turned your head, we couldn't hear you. So you've got to kind of stay either close to the mic because we want to hear everything you have to say.
All right. Can you give me a brief second so I can put on my headphones? Is that okay?
I'm sure that's okay. But we just, what you say is so important. We don't want to have to miss a single.
Absolutely. I think it's right here. Give me a second.
Absolutely. Absolutely. Am I the only one here now? Other than I'll use this opportunity to tell you this is day 2 of the How Healers Heal Summit. 33 female plant-based physicians came together to write this wonderful book and share their stories. We're featuring 24 of them on the show over 3 days. This is almost the end of day 2. You can watch day 1 that is already on YouTube, and day 3 will be tomorrow. And feel free to ask questions by putting them in the chat on YouTube or Facebook or Instagram. I don't see Twitter comments for some reason. And we are back.
Wonderful. Thank you. Is this better?
Oh, it is so much better. Thank you.
All right. Wonderful. It's a little bulky, so I try to use without the mic, but if it, it needs to be audible. Food is a constant in our lives for our bodies to live, grow, and thrive. Yet there are many perceptions, likes, dislikes, and cultural norms attached to food. Throw in a mixture of a growing family, unsupportive partners or roommates, steeped gender roles, and extended family preferences, and meal prepping becomes a never-ending source of pain, unfortunately. Let's take a walk down my memory lane and tease apart some experiences. So after this, I kind of go into my story about how I got to lifestyle medicine, and many, many thanks to Dr. Steve Lavenda, whom I know, personally, Chef AJ, and I attended his program, and and then I got motivated by my friends Sadhna and Radhika locally, and they just got me down this path, and here I am today. So I would also want to talk about I know we've had wonderful discussions over the last couple of days about, what's lifestyle medicine, what motivates people. I did outline some simple steps for the readers. And I would like to just briefly read the title headings. Steps to simple changes. Figure out which method works for you, whether setting a 3-week challenge or slowly cutting back over time. Keep reading more recipes, listening to blogs, kind of get immersed in the subculture, so to speak. Take baby steps. Buy ingredients for one salad. Don't try to stock your fridge and then have to throw everything away at the end of the week. You do one thing at a time. Enlist help from family. You should not be doing it all by yourself. Prep or plan for the week with your significant other if possible. Share ideas a week before, not when everyone is in halt. And we use this acronym a lot in addiction. Hungry, angry, lonely, or tired. It is also okay to step away and take a break. Most importantly, have utmost compassion for any and all efforts that you make. And then a few more options is focus on your sleep, drawing boundaries, getting help with kitchen work. This is what I can do right now. I need to be in bed by so-and-so time. Trying to fit in exercise somewhere into this, it will help. Whether it is only 5 minutes after lunch, make us progress or start somewhere. Social connections. For me, it has always been social connections that helps the most with lifestyle medicine. It's this enchanting and amazing group of people who keep us motivated, and we keep each other growing. Enjoy. This is an amazing journey to begin your self-discovery. So this is what I wanted to read from the book.
I want you to know I just texted Dr. Lawenda to tell him to jump on because you're live right now.
Wonderful.
I just saw him. Actually, I was in LA last week, so that was great.
Oh, that's wonderful.
Yeah, do you guys still have that wonderful program there? I think it was called Plants 180 at Kaiser Permanente?
Yes, so we still have Life 180, and now we have added the physician consult. So you go through Life 180 and you do a check-in with a physician, which is just a phenomenal service that's available for patients.
Right, so you have to be a Kaiser Permanente member in order to see you, correct?
Yes.
Yeah, I thought so.
Yes. And in this journey, I wanted to speak towards like gender roles, because this is something I come across all the time, and I'm not sure if any of the speakers so far have talked about it. Either Dr. Malhotra or Chef AJ, feel free to chime in.
I don't think we've heard about that. So if you want to share some thoughts around it, sure.
Sure. Okay. So, whenever we ask a patient to, hey, you've got diabetes, you've got blood pressure issues, how about making some lifestyle changes? And it somehow seems to be simpler for for patients, who have like family backing for sure, and it's somehow more simpler for males compared to females sometimes, especially because I'm Indian, so I'm speaking in that context as well. There is this, okay, I need to do this, so I will get it done. But when it comes to women, I see a lot of other ideas that come forth. Wow, how can I do this? What will everybody else eat? What will people think? How can we do any of these changes at all? And sometimes it's also kind of self-loathing, like, oh, I'm not a queen. How can I decide what's going to be cooked in my house today and to fit my needs for my diabetes or for my hypertension? I have to make sure that everybody else is fed with whatever their food is first. So let me make like 5 different recipes today for, this one wants to eat this, person B wants to eat this, and person C wants to eat that. And I also have 2 jobs and school. And so I will have to be able to cook in the middle of the night to do any lifestyle goals. So there's always this so much other emotional load that goes into us women making changes. And certainly all of us have experienced that from time to time. And it kind of remains in the shadows or not spoken about. So I thought today will be a good time to talk about that. And, over the years, I've looked at it very differently. The initial is like, why is it so? You want to be upset about this. And you have to flip that script. You have to understand with compassion where this may come from. So I grew up in India, so I'm going to speak in that context. When we were growing up, this is right after food insecurity kind of went away. We had the Green Revolution and the White Revolution. So we had more grains and dairy after many, many centuries of colonization. So it's finally, you don't have that much food insecurity, but you had all of these deaths and famines that preceded in the previous century itself. So the memory in a cultural sense was still fresh. So, having extra food, having more high calorie food is associated with living, and is associated with you're doing right by your family. Unfortunately, now that the script has flipped on, at least in the middle class population. It unfortunately is still true in the lower socioeconomic strata. Like, you need to get your calories in, yes. And it has become that we have all the not so good kind of foods available overabundantly around you, and very little of the nice fresh fruits, fresh vegetables, all of that. But the social norms have not caught up. So that is one aspect. The second aspect is this intergenerational sort of cycle. So like, if say you are, a girl who grows up to be a lady, gets married, you go into this household, maybe it's an intergenerational household where you have maybe 1 or 2 generations who are preceding you in the same kitchen or cooking together. And then it's like, okay, you have to have, it's almost like, med school, like you have to have like X number of years that you try to fit into their narrative or their recipes for like 10 to 15 years until you get the ability to take decisions. No, this recipe or this soup, simple soup, I like in this way with this kind of flavoring. Like even that smallest expression in culinary ways is not afforded to you until maybe a decade later. By then you've changed, your likes and dislikes have changed as we all grow. And then you have your own set of recipes, or maybe you have your own kitchen, or you have some kind of standing where, oh, she cooks well, or whatever, this is how she cooks and this is the way it is made. And then it also becomes like a control issue. This is the only way that I can say that I have some amount of semblance of control in my life. So there's so many aspects, from a philosophical standpoint that go into that. And then comes, with all of the other stresses or just modern life, you get hit with a diagnosis of whether it is diabetes, high blood pressure, or you've had some weight creep and you want to lose weight. And then somebody comes and tells you, well, we need to go back to the previous model. So before all of this happened, before the colonization happened, we used to eat fresh, we eat daily. We used to have these kind of recipes. They would be balanced in nature. They would be good for your body. And it's like, wait a minute. I finally had control in my life in some way or in what I was cooking, but I have to completely change it around. So it's a big deal. It's a big shock in one direction. On the other hand, there are some other themes that also go into it. So your value as a wife or a mom is somehow ascribed to what you're cooking or how much you're cooking or how much you are overdoing everything to serve others, almost like in a codependent fashion. And if you don't do that, then society also will come tell you all of these things. You're a bad mom, you're a bad wife. How can you do this? Sacrilege. How can you cook with less oil? How can you ever do that? What will your children eat? You guys are going to be malnourished. You're going to hear a lot from society as well. So it puts the woman in a very difficult position as to how do I navigate this? How do I understand what my self-worth is? What is my compassion to myself? What is my compassion to the people who are making these comments? Most importantly, where do we go from here? And it's when we think of many people who talk in lifestyle medicine or other, there are tons of people out there saying this is the newest fad or that's the newest fad, not much of it evidence-based. There is this whole pre-contemplative phase and contemplative phase, but there's so much more culturally that goes beyond it that needs to be spoken about.
I mean, you touched on so many points that I feel like could be a conversation in and of itself. I think just as someone, especially many of us in that wrote chapters in this book, right? Many of us, obviously we're all female, but many of us are also mothers, we're wives, and then we're doctors. So we wear all these hats, and many of us are coaches. So we wear all these hats where we're constantly giving, and pouring into other people. And what I learned in my journey is that I became the patient, and there was one day where I literally just couldn't do anything for myself anymore after having, a huge unexpected emergency after my surgeries. And in that moment, I realized like, okay, self-care is not selfish. That's the way we've been taught about it all along. Self-care is my self-preservation, right? So if I want to keep being the mother to my children and the wife to my husband and the doctor to my patients, I have to take care of myself first. I have to feed myself first. I have to move my body first. I have to, do all the things first. I essentially have to put my own oxygen mask on first, regardless of what generations of people might have told women and what society expects of women. So at the end of the day, I think you just have to put you first. And I know that a lot of people don't want to hear that, but once you do that, it will change your life, and it will change the life of all the people who matter most to you.
Right. So well said, Dr. Malhotra. Really. Sorry, Chef AJ, you were saying
Oh, no, I was
something.
just going to say it's so interesting to me because I didn't realize how many doctors are also coaches. And I'm taking a 6-month coaching certification with Food Revolution. And today was the first day that we were learning this. And they were saying how when you're coaching, you want to listen and not give advice and not talk. And I think like when you go to the doctor in general, doctors, I'm not saying they don't listen, but they are giving advice. They are telling you what to do. So it must be an interesting balance when you are a medical doctor and have whether it's a patient or a client, and you know what will make them well, but in the coaching aspect, you can't necessarily work with them the same way. You know what I mean?
But you know what the cool thing about coaching, and we don't learn the philosophies of coaching and behavior change in medical school, but the beautiful thing about it is once you're a doctor and then you go through the coaching training, the first person you actually learn to listen to is yourself. Because they ask so many deep questions, right? Like trying to uncover your why and figuring out your motivation for life. Like those are the principles on which we help people change. And once you start like reading those questions, they ask you in my coaching training, they always asked us to ask ourselves the question first and answer the question before we go then and share it with our clients. So it's an incredible field, I think, health and wellness coaching, because it helps us first, just like lifestyle medicine.
Yeah, absolutely. Doctor, I would like to ask you, in your bio, it says that you practice addiction medicine. And I mean, what does that mean? Because who would come to you, for example, and how are you able to use what you do to help people with their lifestyle? Obviously, if they're addicted to something, I'm sure they're part of the conversation is getting off whatever the behavior or the drug is. But when can you talk to them about a plant-based diet, and how are you able to wear both hats?
Thank you. That's an excellent question, and it's very interesting to combine the two. And in fact, through your conversation with Dr. Malhotra, I love bringing my addiction medicine skills when I'm talking about lifestyle, because that changes the narrative. Like, what is your belief, and why can you not do the self-care for yourself? Like, we try to explore that over time and see where we go from there. So, as far as addiction medicine, any MD who's done residency, say, for example, family medicine, internal medicine, any clinical branches, you can do a fellowship in addiction medicine. So I did mine after my family medicine residency. I did my fellowship in addiction medicine at Stanford University with Dr. Anna Lemke. And then,
oh my gosh, she's been on the show. She's amazing. That's really cool.
yeah, so she is phenomenal, right? And then later on, I practiced in primary care and addiction medicine for a while in San Francisco, and then moved to Southern California to do more addiction medicine. And then that's kind of how it works. So patients can call directly. They don't even need a referral, whether they think that they're struggling from an alcohol or substance use, or they want to just get evaluated. Hey, is my alcohol use getting out of hand? Or sometimes it's even smoking. Like, I've tried the usual stuff for smoking. I want to go see the specialist. How do I quit smoking? So we get direct calls from the patients, or they can be referred by their primary care physician. Either ways it works. You get triaged and evaluated depending on the urgency of the situation. For outpatient, we do like withdrawal management. So if you quit drinking, then it can be dangerous, right? You can have seizures. So we give medications to help kind of ease the withdrawal, or even send you to a residential treatment facility. That's kind of the overview of how it works. And then after that facility, that's not it. Then the real process of recovery starts. So you see us one-to-one, the therapist, you do our classes, and we see you pretty much over the next 1 year. And then we ease off like every 6 months or so. So it depends on patient to patient how their recovery is going. And as far as lifestyle changes are concerned, when it's in the first week or two, patients are not really even having much of an appetite. So we don't say too much at that time, except make sure that you sleep okay and that you have social connections. So those two things we always advocate from a biopsychosocial standpoint for addiction medicine. But once they are like a month or two into recovery, that's kind of where, I'm one of the few people who practices lifestyle medicine. So then I'm like, okay, so what are we doing about your hypertension? Because once you stop drinking or using substances, your blood pressure will come down, but not necessarily low enough to be considered like in proper limits. And so we have the conversation, like, what are you willing to do? And they might be willing to do some small steps based on, what their financial and practical situation is, whether, they are housed, whether they have somebody supporting, whether they have the financial resources. And they're all welcome to our Life 180 program. And many patients do that. So because they already have learned the recovery skills, the coping skills, trigger management skills in their addiction program, they kind of almost ace lifestyle medicine, which is fabulous to see.
I'm so interested as an addiction doctor where you stand on food addiction because I mean, I've had done almost 2,000 shows now. I've had a lot of medical doctors on and PhDs, and some of them think that's not even a real thing. We shouldn't even be calling it that.
So it's fascinating, right? So there's always this debate between eating disorder and food addiction, and I am very, very excited about the topic. So I chaired the California Society of Addiction Medicine conference a couple years ago, and we actually had a spicy debate between the two parties, and it was phenomenal. So food addiction, yes, there's a lot of research going on. The head of NIAAA, Dr. George Koob, is actually working on it from how do we prove it from a brain imaging standpoint. We are just, fascinating work is coming out of there. We are waiting for the clinical translation of what they are discovering at a brain level. So there can be two aspects. You have your regular food, like your whole food plant-based diet, right? So you are not, it's like very hard to get addicted to a whole food plant-based diet. But then you have the ultra processed food where the evidence shows that it almost behaves like tobacco in some ways. And so a lot of the food addiction work is on UPFs or ultra processed foods and how they have features that are distinct from what we would consider a binge eating disorder. So that's like my two lines on it.
Thank you so much. Yeah. Well, I think part of the problem is the name food addiction because you can't really be addicted to, like you say, whole natural plant foods or eating, but I think it's like processed food addiction.
Yes. So UPF, ultra processed food addiction, is definitely what's being researched right now and developing clinical models for that. Now, as far as what do I see in recovery? So if you do quit one substance, your body is going to need the dopamine from some other sources. So you will have a pattern of eating more of those ultra processed foods to satisfy that craving, so to speak. And so we do talk early on with patients like, hey, where are you going with that? Or sometimes, unfortunately, we can also see a very restrictive pattern. So people can flip on the side of, towards anorexia type symptoms. And that is also very concerning. So we always keep an eye out for those issues when a patient is in early recovery. I did want to throw in a plug, Chef AJ, if I may.
Of course.
Yes. So I'm currently writing a book on addiction medicine for lifestyle medicine professionals. Hope to be done by the end of this year. And it's just going to be kind of hoping to have an easy flow, bringing patient stories to life in an amalgamative manner, and then what we can do as lifestyle medicine practitioners.
Well, make sure you do an audible version because I like to listen more than read, and that's a topic that I'm very interested in. And so maybe when you launch it, you can come on the show for a solo episode. One of the medical doctors who says food addiction isn't a thing or isn't real, the reasoning this doctor uses is because you can't die from the detox. So is that a criterion to decide whether a substance is addictive or not, whether or not you can actually die from the detox process?
No, not necessarily. So as far as DSM-5 is concerned, so now when the food addiction scales that Dr. Gerhard and Dr. Koob are developing are very different from the DSM, that is a diagnostic and statistical manual scale that we use for addiction. So the scale is also not going to be different when it becomes clinical. So that's, again, it's going to be a completely different set of criteria that they are currently vetting as we speak, right? And no, there shouldn't be sort of, oh, you only if you can lose your life in detox. So that would not be a fair assumption to make.
Yeah. Well, thank you so much. That must have been fascinating working with Dr. Lemke.
Oh, such an experience, and that too, I got to work with her one-on-one for a year because I was the only fellow for that year. Fabulous.
Wow. And that you were close to me then. That's really neat. Well, thank you so much. Yeah, when the book comes out, let me know. It sounds, and will the book be only for clinicians or could lay people also read it and glean some information from it?
I think it should be accessible for both.
Okay.
The way I'm writing it, it's kind of very easy flowing.
Great. Well, congratulations. We know not we all know, but all of us who've written a book know how long it takes and how hard it is to write a book.
Yes. Thank you so much for your time.
Yeah. Thank you for being here.
Thank you, Dr. Mythica. And now I am excited to introduce our next speaker is Dr. Shilpi Pradhan. She is she is the fearless leader behind this whole project, How Healers Heal. So I'm very excited to introduce her. She is a board-certified ophthalmologist, board-certified lifestyle medicine doctor, mother of 4 beautiful children, and a personal finance and real estate enthusiast. She's interested in the impact lifestyle medicine can make on eye diseases and overall health. She went to Emory University in Atlanta, Georgia for college, Washington University in St. Louis for medical school. Her training included a transitional year at Carilion Health Systems in Virginia and an ophthalmology residency at the Medical College of Virginia, Virginia Commonwealth University in Richmond, Virginia, and a cornea external disease and refractory surgery fellowship at the University of Pittsburgh Medical Center in Pittsburgh, Pennsylvania. She also has been an assistant professor at St. Louis University in St. Louis and loved teaching residents before moving to Virginia. She owns her own solo practice, Eye Doctor MD PC in Glen Allen, Virginia since 2015, and practices ophthalmology with lifestyle medicine education for her patients. This book, How Healers Heal, was a project conceived by Dr. Pradhan and Dr. Sharif in January of 2023 about how transformative lifestyle medicine has been in their lives, and with shared enthusiasm from Dr. Huber and Dr. Sunkareddy, this project was born. Dr. Pradhan has a passion for writing, editing, and creating. She led the project, edited the chapters, designed the website, and published the book under her company, Pradhan Publications. So if you are interested in publishing your own book, she is definitely someone to reach out to. Welcome, Dr. Shilpi.
Thank you, Simran. Thank you, Simran. Can you hear me okay?
Yes, we can.
Okay, great. Thank you for hosting us, Chef AJ and Simran, Dr. Simran. This is amazing opportunity for us to share our message. As you already heard, this just kind of started as a conversation with Dr. Sabah Sharif last year, a year ago, January. And we were just talking about how transformative lifestyle medicine has been in our lives. You heard from Dr. Sharif yesterday about how it impacted her weight loss and her father's heart journey. And it impacted mine, which I'm going to talk about. And we were just talking like, wouldn't it be great to put out a book? And through the power of social media, we got together this amazing group of female physicians. It was actually a little bit bigger in the beginning, but those who submitted a chapter and edited with me together to get to the final product, that's how the final book happened. And we have been so grateful that the American College of Lifestyle Medicine has embraced the book, has allowed us to do the donation once we get to our goal to help their HEAL scholarship, which is for health equity and in improving the access to lifestyle medicine. And their partnership and support has been amazing. We were able to present the book at the conference last October. So amazing, amazing. Any questions about the creation of the book? And I just wanted to talk about my story and my chapter, as well as some ophthalmology patients who I've impacted with my lifestyle medicine knowledge, which I wouldn't have before, learning about all of this.
I'd love to ask about the book because I'm not a doctor, but I interview a lot of doctors, and I've hosted 6 summits now, so probably close to 300 doctors. And I find just to organize them for a series of interviews is kind of like herding cats. And I'm just so impressed that Dr. Malhotra could get 24 of you guys. What was the process like? Was it difficult to get all these 24 stories in the time that you needed them? Because the people seemed highly motivated and wanted to do it, but wanting to do something and then actually doing it is sometimes a different thing.
I don't think it was difficult. We're all so passionate and we've all been so transformed. And I think we're so grateful that lifestyle medicine found us, or we found it, somehow. And no, it wasn't. It was such a collaboration. Like if you look at the front cover, in the title, even the title was, we voted on titles for probably a month. This one, How Healers Heal, was a contribution from Dr. Mythica, who we just heard from. And then the subtitle and the cover design was Dr. Cherie Chu. And if you look at the word heal, all the symbols on the cover, the apple, the person running.
I love it. I detected that. It's all the pillars of lifestyle medicine.
Yes, all the pillars of lifestyle medicine. So like this was such an amazing collaboration of everything. So the front cover was, and the title, and the back cover. I designed the back cover. I pulled these quotes out from different chapters that I just thought were amazing. I wanted to put all of our pictures because it was such a collaboration to put it on the back cover. So anyway, so
I think
it was fun.
I think you should have an in-person conference or retreat with all the doctors there so we can all meet y'all in person.
We would love to do that for sure. We would love to make our donation goal to the American College of Lifestyle Medicine, and then hopefully do a celebratory meeting. Next conference is the ideal time. I think it's in Florida. It should be amazing. Maybe we can piggyback a day before or a day after.
Maybe I should add that to the show notes, in addition to the link to buy the book, that all donations go to the American College of Lifestyle Medicine.
Yes, we're aiming to donate at least $10,000 for their HEAL Scholarship for Health Equity.
Very nice. I'm excited that the Audible version will be coming out soon. Did each doctor record their own segment?
That was the hope, but that is not the case. Majority of it is recorded by me in a recording studio. I think about 10 or 12 doctors did their own chapters. But I think it's hard to get in a recording studio, the time commitment, all of those things. But they were okay. Obviously, we've all talked to each other. Well, I've talked to every single one of the authors, so they know my voice, they trust my voice and my intonations and my emotions and into reading their chapters well. But again, as a collaboration, they've had access to the entire manuscript the whole time we were putting it together, although only finished chapters, and they have access to all the Audible files as I'm recording them in the studio and as they're being edited by the audio engineer, all the things. I'm learning so much about this process.
That's great. And you have your own story in the book as well.
Yeah, I mean, that's where it all started. So just to make sure that I cover what you wanted us to cover, my practice is in Richmond, Virginia. I see mostly ophthalmology patients. I have thought about starting a lifestyle medicine practice within it, because it would be covered by insurance. I don't really do telemed except for dry eye consultations, but I've thought about adding the lifestyle medicine component because it has changed me so much. I am on social media, mostly on Facebook, but thankfully now it's linked to Instagram, so everything posts to Instagram as well. I probably need to hire a VA for the number of messages I get, but if you send me a message, I may or may not respond. The best way is probably through my office and through my staff here. Just to cover what you're saying. Okay, for my chapter, I wrote about chest pain, PCOS, and fertility, and I also gave some patient examples that have been impacted by my lifestyle medicine teaching. So I'll just go through that briefly. This first started about 7 years ago, and I had an episode of chest pain when we were traveling to Florida, and it felt like an elephant sitting on my chest, and it was scary because whenever we learned about elephants sitting on your chest, it's a heart attack. And I actually drove myself to the ER in Florida when we were vacationing with our older 2 children to Disney World, and, got admitted and checked everything out, and everything was fine, thankfully. But it was a wake-up call to me, like, what is going on with my body? So I started reading about nutrition. A doctor here in the community gave me a book called Beat the Heart Attack Gene, and that started my learning into nutrition, especially for heart health. And then I learned about Dr. Campbell's plant-based medicine course on the eCornell website. I started taking that and became vegan and plant-based for the first time. And I never had any more chest pain. But the surprising thing about that change in diet is I've had PCOS since I was, 16, had irregular cycles. I know people don't talk about this a lot, but I think it's important to talk about. But within 3 months of being plant-based and vegan, my cycles were completely regulated, like on the clock. It was amazing. So it made a huge impact in PCOS. And then within 6 months of that change in diet, I was pregnant again at the age of 40 when I had had some infertility issues and a miscarriage due to other issues at pretty far along of twins of 21 weeks old, which was devastating and heartbreaking. But this is the impact of this diet change is, I had this surprise pregnancy at 40. And it didn't really hit me that it was due to my plant-based diet or vegan diet until I became pregnant again at age 42. So I had 2 surprise children because of lifestyle medicine, because of my change in diet, because of being plant-based. And I mean, that's phenomenal. There's 2 more humans in the world because of me learning about lifestyle medicine. And maybe I'm heart attack free because of that. I know Dr. Bernard wrote a book, his latest book, Your Body in Balance, talks about patients with PCOS and they're being regulated and improved fertility. So, I mean, there's so many stories out there, but I want to give women hope who have PCOS or infertility or irregular cycles that being plant-based is really important to regulate your hormones. For me, gluten was also a huge factor because it is linked to infertility and miscarriage. So I'm also gluten-free. Are there any questions about that topic before I talk about
Actually, there was a question because you had mentioned you're an expert on dry eye and that you'll do a virtual consultation for that. And actually, Marcia said, that she's already whole food plant-based, very strict on the diet. And do you have some recommendations for dry eye? Because diet alone is not something that can help it, or is it?
Diet alone is not something that can help, but it is a huge factor. My dry eyes, I've had dry eyes since I was 25, and being gluten-free, which is a known cause of inflammation, and being plant-based has helped my dry eyes a significant amount. But there are so many treatments for dry eye that people don't know about. And that's why I wrote, actually, my first book before How Healers Heal was just an exercise, was Goodbye Dry Eye. That's this book. And I also wrote I'm doing a digital course just to walk patients through everything that's available for dry eye disease, because it's almost a mystery. It's like, eeny, meeny, miny, mo, pick a eye drop on the shelf. Which one is going to work for me? And I want people to have a systematic way of treating their dry eye. And in my book and in the course, I have a whole section on lifestyle medicine and the impact that different things can make on your eyes. But of course, there's many other therapies that would help.
Well, that sounds like an interesting standalone show if you'd like to come back about treating dry eye. She follows up with a question that she also has blepharitis. Are the 2 often related?
You mean dry eye and blepharitis? Yes, that is. So blepharitis is just a word for crusty eyelashes. And that's it. So, but yes, they are related. So blepharitis can be caused by especially sugar imbalance. We know how inflammatory sugar is, and the dysregulation of sugar can create poor secretion of your oil glands and your eyelids, and that can contribute to crusty eyelashes. I don't know if I should talk about this, but the main cause of blepharitis that I see in my practice is actually a little mite, a bug that lives in people's eyelashes called Demodex. And of course, they love sugar too. So cutting out sugar, processed sugar, is huge for helping blepharitis. But of course, if you have a mite, you need an anti-mite treatment medication.
Thank you.
Okay, well, I want to move on to the patients. I wrote about a few of them in my book, but in the chapter, but I wanted to just point out some into just using lifestyle medicine in my ophthalmology practice. I had a patient with scleritis, which is basically like an arthritis of the sclera, the white part of the eye. And she came in with this horrible nodular scleritis due to rheumatoid arthritis. I think I have a video testimonial with her on my YouTube channel. She's amazing. But I just told her about lifestyle medicine. I told her about being plant-based and decreasing her inflammation. I didn't know she would actually do it. I called her rheumatologist. We got put her on steroids, oral steroids, prednisone, which can cause weight gain, can cause blood sugar problems, all the things. And I saw her many times, but within 2 to 3 months, her scleritis was completely resolved, and she had lost 60 pounds, which I was blown away because, prednisone causes you to gain weight. And she was like, yeah, that day you talked to me, I went vegan and plant-based and my whole family's changed. And I was like, oh my gosh, this is amazing. And the fact that she was on steroids and lost weight and was able to get off steroids and control her scleritis. And that was like 4 or 5 years ago. And she hasn't had another flare up, which is amazing. Recently, I had a patient just a month ago. I want him to get on camera because he's amazing. A 50-something-year-old, he's camera shy. So I'm going to hopefully get a testimonial on my YouTube from him. But he came in with double vision. He was admitted to the hospital. Nobody knew what it was. They sent him to me as an outpatient. I was like, this is all from diabetes. You just got diagnosed with diabetes. This double vision is a 6th nerve palsy. So that's the nerve, one of the nerves that controls the muscles in the eye. It was abnormal. And I was like, this is not forever. I promise you, if you change your diet, this will resolve in 1 month. And your motility will come back, your double vision will be gone. And he actually took what I said to heart. He didn't become vegan, but he stopped pork, he stopped beef, he stopped all red meat, he stopped snacking, he stopped all processed sugar, which is amazing. So he's on chicken, fish, and plants. And he's lost like 35 pounds in a month. And he came back and he was like almost in tears. He's like, you're so right. My double vision was gone in a week. Like, this is so powerful. No one recognizes me at work because I've lost so much weight. And I'm so happy. My diabetes is almost gone. I'm like, I could just be like, oh, this is what it is. Like, you might need eye muscle surgery in the future, but I didn't do that. I shared the power of lifestyle medicine and gave him hope, and he listened and took that and controlled his life and outcome. I have another patient who had a stroke. This was an amazing story. She's like an 80-something-year-old. It's very sad, actually, because she still has visual loss from it. But she had 2 strokes within 3 months of each other where she lost half of her vision. And they were immediately 1 hour after eating bacon.
Oh my God.
Yeah, both of them. So when she comes in, of course, I'm doing the eye evaluation and her visual field and her pressure and discussing like what is happening. But I dove deep into, I was like, so what did you do before this happened?
Oh, sorry, that was a message for Dr. Malhotra. I apologize.
Oh, okay, no problem.
You're great. You're great.
And so I just was diving deep into her diet. And in my mind, and I even said it out loud to her, I was like, I have a choice. Like, do I just tell you had a stroke and because you're 84 years old or whatever, and like, this is what it is, this is how it's going to be? Or do I share with you everything I know? And I decided that I'm going to share with her everything I know. And I told her that. And I'm like, in my mind, I'm having this battle, but you know what? My job is just to educate and to tell you, that I think the bacon was the cause of your stroke. And she listened to me and she gave up all red meat and processed meat. Actually, no, she didn't give up all because she still eats turkey bacon, but she hasn't had another stroke. So, and then lastly, I just wanted to mention gluten and iritis and smoking as another pillar of health. So smoking is a huge factor for eye diseases. It increases your risk of glaucoma, increases your risk of macular degeneration, converting to wet macular degeneration and vision loss. It's a huge risk for iritis, which is inflammation of the iris, kind of like the scleritis. And then gluten is also a linked thing. So I'm talking about smoking cessation in a lot of patients all the time. Anyway, so that I love incorporating it into my discussions with my diabetics, with all the other eye diseases. And I hope I don't bore my patients or your audience, but it's given me such a gift, lifestyle medicine. I'm so grateful. And this book was a great opportunity to share my gratitude for the field.
Well, thank you so much. And all your work sounds so interesting. And seriously, if you want to come back to talk about it, a live viewer has a question named Angela saying, do dry eyes go away without antibiotics? I've never heard of that for dry eyes.
Yes, they do go away without antibiotics.
Right.
Depends on the cause. Yeah, I would love to come back. Thank you so much.
Yeah, no, it sounds like a fascinating topic. And Diana is saying that she started developing dry eye after going through chemo.
That's a huge factor. My husband's a hematologist oncologist, so I do see a lot of chemo-induced dry eye, which is a whole separate subcategory.
That's great. Well, thank you so much. This was, this whole idea is endless. I mean, you could do more versions of this with all kinds of doctors, lifestyle. You even have men sometime if you want, or just
Actually, Chef AJ, at the book reading on Saturday, I haven't told Dr. Shilpi this yet, but one of the men actually came up to me and was like, "Why is there only women in this book?" And I was like, "Well, thanks for the inspiration. Maybe we need to create one with all men's stories, and you'll be the first one," because he was diagnosed with early stage colorectal cancer and just was sharing with me how his life transformed after he went whole food plant-based. So
yeah,
there we go.
absolutely. That's great. Well, thank you so much for this wonderful idea. And I tell you, if you have a conference, I'd love to host it with just all the 33 wonderful clinicians.
That was amazing. And I'm sure you heard from yesterday's authors. We're going to do a cookbook. We have a workbook, and we are going to keep taking this message forward.
The cookbook's going to be amazing. I can already tell. So last but not least is our co-host for this wonderful 3-day event, Dr. Simran Malhotra, and I have the privilege of introducing her. She's been on the show before. She has an incredible story of her own healing that's very inspirational. If you haven't seen it, I really encourage you to watch it and or follow her on her Instagram channel. She's a mother of 2. She's triple board certified physician in internal medicine, hospice and palliative care, and lifestyle medicine, as well as a certified health and wellness coach. And she also completed the T. Colin Campbell plant-based nutrition certification and the chef culinary coaching certification, which I just first heard of yesterday from one of the doctors. It sounds amazing. I would love to take that if a non-clinician can do that. She's been featured on several blogs and podcasts where she shared her unique perspective and experience from palliative care, as well as from being a genetic mutation carrier who's passionate about using lifestyle as medicine. She founded Wellness by Lifestyle, a platform where she educates women at high risk for cancer with or without genetic mutations on the powerful impact that positive lifestyle changes. We'll have her other information like socials and website in the show notes. Please welcome my co-host, Dr. Simran Malhotra. I'm thinking palliative care, that's not somebody like we really want to see, right? If we don't have to.
Yes, you don't want to see me in that capacity. Although, I recently am embarking on this journey of figuring out how to incorporate lifestyle into my palliative care practice for my seriously ill patients. Because as we know from the works of, Dr. Esselstyn and Dr. Ornish, even people living with advanced disease can benefit from these principles, especially whole food plant-based diet. So we'll see how that goes. But I do wellness, lifestyle coaching, small amounts of it, but I do that. So, and then a lot of content I create for Instagram. So anyone can follow me there. So today I'm going to read you a page and a bit of my chapter, and then share kind of the transformative piece that I learned over the last 8 years. And then maybe we can talk a little bit about food for cancer risk reduction, particularly breast cancer, if that's something that's interesting. So I am chapter 14 in the book, and the title goes, "Our Genes Do Not Determine Our Destiny, a palliative care doctor and BRCA1 previvor's journey to embracing lifestyle and mindset." It starts with a quote that says, "Sometimes the bad things that happen in our lives put us directly on the path to the best things that will ever happen to us." And it's by Reed. Cancer and I crossed paths for the first time when I was only 13 years old, when my mom was diagnosed with breast cancer at the young age of 33. Since then, I have had many life-altering experiences, my own, those of the people closest to me, and even the stories shared by many of my seriously ill patients, some of whom shared 2 things in common with me: a genetic mutation, cancer, or both. 8 years ago, in 2015, I was 27 years old, finishing up residency and getting ready to tie the knot with the love of my life, when I got my genetic test results back showing that I carried the breast cancer 1 or BRCA1 genetic mutation. The same mutation I had read about in medical school that could now magnify my lifetime breast cancer risk by up to 87% and ovarian cancer by 50 to 60%. And just a side note, the average woman's risk, lifetime risk of breast cancer by the age of 75 is about 12%, and ovarian cancer is less than 5%. So I had a massively increased risk. I remember sitting in the genetic counselor's office with my fiance when she shared the results of my pathogenic BRCA1 gene. Tears streamed down our cheeks as we held hands tightly, both of us feeling a rush of emotions in that moment. We were all too familiar with what cancer looks like up close, which left us feeling even more overwhelmed with all that may lay ahead. A year prior, my mom had discovered that she carried the BRCA1 variant as well, and I encouraged her to retest many years after her initial diagnosis and following the news of another close family member who had recently been diagnosed with primary peritoneal carcinoma, an aggressive and rare form of ovarian cancer. This diagnosis was the red flag that sounded the alarm for me that something in my family was not right. From there, I began digging into my maternal history, which was hard since discussing cancer, illness, and death is just not what we do in my family, nor is it part of the cultural South Asian norm. And as I share now, as a palliative care physician who's been caring for the most seriously ill people for the last 8 years, nobody likes talking about death. It doesn't matter who you are and where you're from. Yet I persisted. What I found was shocking. Sadly, 9 women in my family, 10 as of today, have experienced some form of breast or ovarian cancer. My mom is a 2-time breast cancer survivor and thriver today. A number of these courageous souls are no longer with us here earthside. The year I found out about my mutation was the year I also started my specialty training in hospice and palliative care, a field specializing in caring for people living with serious life-threatening illnesses, often nearing the end of their physical life. This was an especially challenging time as I tried to navigate understanding what my genetic mutation meant for me and my future, while also caring for several young patients with advanced cancers. I began to see up close what cancer can take away from a patient and a family, but also what resilience and hope look like. There was one young woman in her 40s with advanced ovarian cancer who happened to carry the same genetic mutation as me, who changed my life. A few days before she died, she found out from her sister I carried the same mutation as she did. And she said, "Simran, don't let this happen to you. Do whatever you need to do to live a full life. Stay alive for your future children. You have a choice." In that instant, she lit the flame of curiosity, knowledge, and power in my heart. I learned how to use that fire to make informed decisions about my life and learn not to take no for an answer, even from a lot of doctors. This was exactly the sense of control I needed when everything around me seemed chaotic and uncertain. At that time, I didn't know exactly what that meant for me, but I vowed to find out. The next steps became clear as I met with a medical team made up of genetic counselors, oncologists, breast surgeons, plastic surgeons, all who shared with me the latest data on risk reduction in women carrying a BRCA1 mutation, particularly with my strong family penetrance, which included serial imaging and surveillance, as well as prophylactic surgeries once I was done childbearing. So here I was, 27 years old, and I had 5 very big life milestones that needed to be accomplished within the next 6 years. One of them was prophylactic surgeries per my medical team by the age of 33, the same age my mom was first diagnosed with breast cancer. So fast forward to 2020, and I ended up having a bilateral risk-reducing double mastectomy with aesthetic flat closure and a total hysterectomy, putting me in surgical menopause at the height of the COVID-19 pandemic, working as a palliative care physician, married to a critical care physician with 2 little kids under the age of 2 and all our family in Canada. Sometimes I have to take a minute to even process that year, and I can say although I haven't lived my whole life yet, I can say that 2020 will go down as one of the most challenging years of my life, but also the year that I grew into the strongest version of myself. And while surgeries radically reduced my risk of cancer, today my breast cancer risk is less than 5%, ovarian cancer, same, less than 1 to 2%. What actually saved me as a mother, as a wife, as a doctor, and as a human being is actually when I discovered the power of lifestyle and mindset as medicine. And so I've spent literally the last 8 years doing extensive research, trainings, certifications in anything and everything that I could find that was lifestyle and mindset as medicine, evidence-based, of course. And what I learned was everything my doctors told me wouldn't help because I have a genetic mutation. What I learned was everything that wasn't taught in medical school or in my residency training. And here's what I've learned. It really comes down to this, and I'm not sure if I shared this yesterday, but wellness is a mindset. And that is determined by something called our state, which I can then break down into 3 aspects. Our state is made up of our focus and beliefs, our language, and our physical body. Our focus and beliefs is the way we see the world. It's our model of the world. It's the way we choose to see the everyday things and events that happen in our world. It's the questions that we ask ourselves. Like I said yesterday, is life happening to me or is life happening for me? Is there something in this moment, despite the chaos, that I can learn or grow from, despite the pain? And like I mentioned yesterday, it's about controlling the controllables versus sitting in fear of getting cancer one day. Number 2 is about our language. Our language is the words that we use to describe our experience. It's the meaning that we give our circumstances. So for me, the BRCA1 genetic mutation was always a blessing in disguise. Did I have moments of debilitating fear and anxiety? Yes, especially because I worked with young dying patients, but I always looked at my genetic mutation as a gift. Why? Because the meaning I gave it was the privilege that my mom and my patients did not get. And I know that if any of them had the chance to do something to reduce their risk of cancer, they would have taken it in a heartbeat, especially because some of them might even still be alive today. And number 3 is our physical body. This is the food that we're eating. This is the way we're moving our body. This is the people we're surrounding ourselves with. These things have so much impact in their ability to reduce our risk of cancer. There is nothing that will completely take away every risk of any disease, but there's a lot that we can do to control and reduce our risk. And as a palliative care physician who's taken care of seriously ill and dying patients for the last several years now, I can tell you, based on my own experience and the experience of my patients, that your lifestyle, the food you eat, the way you move, all of these things are the greatest investment that you can make for your quality of life, not just for today, but also for your future, to reduce your risk of chronic disease in the future. And all of this doesn't just affect you, it also affects everybody in your life. Because I can tell you that when you get sick, it affects everyone in your circle. And so I've learned that through focusing and having the proper beliefs and through language and through the things we do with our physical body, we have the ability to live in a beautiful state, even in the most chaotic times of our lives. And what I'll share with you just in closing, and then we can answer some questions, is that we don't experience life. We experience the life that we focus on. And Chef AJ, I know you wanted to talk
Yeah,
more
you have.
about plants.
Well, we're
but
gonna
really
yeah,
needed to
actually you're
share
gonna be back to you're gonna be back tomorrow for part 3. And very often in between speakers, there's some time to mention things while we're getting to the next speaker. So we would love to hear more from you about how you've implemented the diet in your life and in your family's life. But you have such a powerful, powerful story, and I hope people will either read the book and I was gonna say listen to it then, it's not on Audible yet, and read and glean it then, or follow you on Instagram, or perhaps just watch the previous interview we did.
Yes, no, for sure. I know one of the questions you had wanted to talk about, I know we're at time, but maybe tomorrow in between one of the interviews, we can talk about some of the plant-powered foods that we can use to reduce our risk of cancer. That was where my journey started when I found Dr. Michael Greger and read How Not to Die. Completely changed my life. So I'm so passionate about talking about food as medicine, and I would love to talk more about that tomorrow.
That's great. Thank you so much for helping me do this, because if for no other reason, some of the names are really hard to pronounce.
Of course, of course. Well, I think day 2 was incredible. So many of the doctors shared, as I just did, very deep, vulnerable, and personal stories. They talked about advocating for yourself. They talked about empowerment. And we learned so much about how to turn our pain into our purpose, not only to help ourselves, but to help all our patients. So that is a wrap for day 2, and we will be back with several more speakers tomorrow for day 3 of the How Healers Heal book summit on Chef AJ.
Oh, thank you so much, Dr. Malhotra, and thanks all of you for watching another episode of Chef AJ Live. Please come back tomorrow for day 3 of the How Healers Heal Summit. And if you missed yesterday, you can watch it. And tomorrow, we hope you'll come back.